All right. Hello, everyone. Thank you for joining. I want to welcome you to the Cannabis Society's inaugural virtual conference series. My name is Graham Davis. I am one of the co-founders and investors of the Tech Society. So my primary role in the company is to manage the Cannabis Society. And specifically, I oversee a team of wonderful individuals who have come together to promote and manage over 50 cannabis executive conferences around the world each year. As mentioned, today is our first virtual cannabis-themed conference. So, I spoke with the Tech Society CEO, Bill Hennessy, roughly, it must have been six, 7 months ago about doing something like this. Over the past year, as we've expanded the Cannabis Society across various international markets, it's been pretty clear to us that through the cannabis business community, though it's somewhat small, where you go to these conferences and everyone kind of knows everyone, to some respect, I should say, it is in fact growing at a rapid rate. With so many new players coming to the table each passing month and so many regulatory changes constantly shaping and developing opportunities within specific markets, we thought that an effective way to help our partners and members stay abreast of what is happening in local markets is to connect our network through an accessible medium that doesn't require plane tickets and hotel rooms to gain access to. So, as we kick off this first virtual conference, I do want to be transparent with all you and let you know that this is a very experimental initiative that we're undertaking. In keeping with the Cannabis Society's mission statement, it is important for us that for all you who give us your time, which we know is extremely valuable, we want you to walk away from this experience feeling as though it was worth the ROI. In our in-person conferences, for example, we provide value through one-on-one meetings, personal connections, ensuring that your business development needs are met, and we're helping you hit whatever KPI those needs represent. You'll find as we move forward that every virtual conference, we will be expanding on this platform and honing in on your feedback, the community's feedback, in order to ensure that through us, your time is well spent. So for example, the memberships that you all would have signed up for to gain access to this conference today is, perhaps a look in the direction that we see these conferences headed. And not only, the conferences, but the Cannabis Society's platform in general. And so what I mean by that is it's all about strengthening relationships, building community, and more or less, again, another avenue to help you connect with your target group. So we see this membership program, it's an ability for us to help expand your networks internationally. Again, thinking about what are those business development needs you have, who are those key individuals you need to meet, and no longer those introductions being limited to conferences alone. So moving forward, what you can expect is, yes, we will continue to do physical conferences. However, what I'm getting at here is that as a society, we are expanding to allow for more virtual connections. Again, reinforcing that concept of helping you meet who you need to meet. And for us to help you, we ourselves rely on the support of our sponsors. So it goes without saying, we are very grateful for our partners on this inaugural virtual conference. A big thanks to Zuber Lawther, AC Lyon, Grant Thornton, and Miller Thompson. So without these partners, this platform could not exist. So a big thanks to all of you. And the last thing I want to talk about before we move into introductions is our upcoming virtual conference schedule. So as you can see here, our next virtual conference will be December 25th. The theme of this one is accessing North American capital. So what you'll see, I get from a panel content as well as participation standpoint, will be investment banks, Canadian LPs, VCs, and Ps. And then December 19th, so less than a month later, we will be doing another virtual conference. This one will be specifically targeting accessing the German and European markets. So within this past year, we've seen so much development and regulatory change happening in Europe. I'm sure we all have a pretty good idea of what we think is going on, but hopefully through this virtual conference, we can hear firsthand from some of the folks working on the ground.
Oliver, Boris, how are you? Good morning.
Hello, Boris. Nice to meet you this way. Very good afternoon to you. I think we are on the same time zone, if I'm not mistaken.
Good afternoon to you. Nice to meet you, Oliver.
So for those who are watching and viewing the first panel, and what has been expected to be the biggest opportunity in cannabis. What we're going to focus on in this panel is strictly the current market to provide insight in what is happening on the ground right now in Europe.
Boris, do you want to go first?
Sure. I don't think I heard the question.
So I'm going to pose the question. Yes. So I'm sorry. I was just waiting, giving the introduction to you two. So would you mind providing, Boris, a basic outline of the current cannabis market in Europe, the regulations, and the capacity to do trade with any?
Sure. So, Europe is actually a fast-moving market right now. Personally, Cannabis Society is not involved with THC yet, but what I can tell you is that the regulators still have not, come together yet to come up with rules and regulations for everybody to play by. This is causing this. I think that the real reason to this is that there's still a serious stigma associated to the plant, and until we have more studies coming up, clinical trials proving the efficacy and the power of the plant, I think doctors will be wary of prescribing cannabis-related or cannabinoid-related therapies to the public market. Now, Europe is, on the CBD side, I should say, things have also kind of come to a halt due to novel food. Novel food is, for those who don't know, is a food category that was put together in 1997. So that basically any new ingredient put into food after 1997 needs to be approved by EFSA. And these products go through a very rigorous process, and nobody has been awarded yet a novel food license. And this is also another reason why the progress here in Europe has been quite slow. So there is workarounds around this. I don't think, let's say, companies are too preoccupied by novel food right now. They haven't really come down hard on anybody. I think there's ways to kind of work around the novel food regulation by categorizing your CBD or cannabinoid-related product as a cosmetic. You can go to an extreme case and also sell it as a technical product, which basically means that you can't use it for human consumption. You can use it to lubricate your bicycle, but not do not consume it. So regulatory-wise, I think things will change in the future. How soon is anybody's guess. I think Luxembourg taking the brave step to potentially take it recreational in the next couple of years will definitely kickstart the process of legalization here in Europe.
Andrew.
And yes, and Oliver, I'd like to hear what you'd have to add to any of those points in that question.
Yeah. Well, I thought it was a good answer. So I'm looking at it. You asked what's the biggest opportunity here. I think you need to put this into a matrix. A, it's what's near-term available, what's long-term available. B, which geography do you go to, because the regulations are applied quite differently. And C, within the product categories, which ones are regulatory easier to get through than others. And that leads, I think, us here at FullUmed to the following conclusions. We believe that the near-term opportunity here over the next 24 months clearly is on the CBD side. We are in the THC business, but that requires a very meaningful amount of research and development upfront. And we believe that the THC side of the business really will not take off outside of flower, till about 2 years from now, and in particular in Germany. So firstly, CBD first, THC second. Secondly, with regards to geographies, and again, you distinguish between CBD and THC. CBD, biggest market right now for us and easiest to commercialize is the United Kingdom. And for THC, it will be Germany. And we are making fundamentally the bets on both of these markets at this point in time. Thirdly, with regards to product categories, and here I'm just looking at CBD, I think the products which you can most easily commercialize, given that we have all these regulatory constraints, are topicals. They are significantly easier to get into the physical retail channels than what are tinctures and soft gel capsules or hard gel capsules. Finally, I think if you look at distribution channels, also again the near-term opportunity on our end is, first of all online, and then secondly drugstores. But the drugstores, I cannot speak to Switzerland, but drugstores I think in particular open in the United Kingdom. So you need to create this matrix where you're looking at the timing of how fast you want to be into the market. Secondly, which geography, in which channel you're in, and which pieces of the CBD market, I think, particularly in the near term, you want to tackle. And that's, I think, where we are coming out in terms of prioritizing our product range and for this time being.
Yeah. Let me jump in. Nice to meet you guys. How's it going?
How are you?
Good, good. Yeah. Okay. So I just want to pick it up kind of just what we were talking about on that last point there. Well, cultivation costs in countries like Greece, Portugal, Croatia, or Spain, are they going to be able to compete with Colombia, Africa, Southeast Asia prices? And so, what we always hear when we do these conferences is that, these South American or Asian Pacific countries are going to be able to cultivate, at such low prices that it's not only going to flood the market, but it's going to drive out a lot of these cultivation facilities popping up in Canada, US, and Europe. What's your guys' views on this? Maybe we'll start with Boris, just to keep the conversation going there.
Sure. Thank you, Graham. I would say that in pure production costs, you're probably right. South America, Africa, and Southeast Asia will most likely have cheaper production costs. But when you factor in, all the other costs associated to bringing a product or final product into Europe, which is logistics, import taxes, etc. At the end, you're going to be talking about less the same price. And again, Europeans, I think, tend to favor European made products versus something made in, Southeast Asia or Africa. So generally speaking, that's what, I think the general consensus is of the buyer here in Europe. I don't know what the answer is yet. I mean, we're going right now through the process of establishing a grow in Europe, in Greece, actually. And I would say that Greece would definitely have more favorable production costs than, let's say, Spain or Portugal. Let's see. I think the question still needs to be answered. I like the fact that if we do produce in Greece, we'll already be in the European market, and we can get the products out extremely quickly.
Interesting. Oliver, do you have 2 cents on that?
Yeah, well, we are cultivating in Colombia, so I mean that may be a bias, but So we are very confident. We brought our first harvest in. We are hitting anywhere between 5 to 10 cents per gram of dried flower for CBD, that is. So I have very little doubt that I think South America will be in the top tier of low-cost producers. I think we will find difficulties in the CBD and hemp side of things to compete against the Chinese. We are starting to get inquiries from Chinese people who want to do licenses in China using our technology. And I think if China comes on stream, I think even we in Colombia will have some issues. Now, having said this, in the same line as Boris, I think, was saying, I think right now, as of today, certainly the cost on the THC side of things, prescription medicine is still, as of today, irrelevant. And I think will be irrelevant for the next 5 years. I think this is about a quality product which is produced to pharmaceutical standards. And I think you're not in the near term seeing a significant pressure on price, and are only going to be a handful of people who can do this. On the CBD side, I think it's very different. I think we believe, and we will use our ability to produce low cost and manufacture in Germany, in a German pharmaceutical facility. We will use that to be disruptive in terms of pricing. And I think that will be hard, I think, for other people to beat. Time will tell, but I think we're, at this point in time, we think on the CBD side, if you're cultivating in Northern Europe, I mean, hemp in Northern Europe, I think you'll have a very hard time to be in the business within 3 years from now.
That's interesting. And so, and I wonder though, how educated are the consumers? You know, we think of like other consumer products and whether or not it was produced in or manufactured in Asia or manufactured in Europe. Sometimes at the end of the day, it is about price. So Boris, just continue, or Oliver, sorry, just continue with your point. Do you think the consumer will be educated enough to want to buy, or to not, care about whether it's Europe, Colombia, or China, and it will be price that will ultimately just dictate who will win?
No, I think it's more complex, and it goes in the following way. I think, as Boris said, you will see consumers wanting to have a locally manufactured product because they're concerned about safety. So this is, I think, what you absolutely need. And I don't believe you can bring in product from Colombia unless you have a very high quality standard in terms of manufacturing. Then the second question, I think, is to what extent, as in your marketing, you are using the fact that you're a vertically integrated cultivator like what we are today as a guarantee to the consumer that you can do a tracking from seed to sale, and therefore can guarantee every single, you have your own genetics, you have a open air cultivation, which is ecologically sustainable. That's a very big point here in Europe, I think, for most of the consumers. So I think this is how it comes together. But no, I don't think that in this business, in the CBD side of business, that being just cheaper and bring it in from Jamaica, South Lesotho, or somewhere else will be happening. I think it's more complex than that.
Well, and Boris, maybe I'll pass this over to you. You know, when we talk about, for example, safety and so quality of product, I mean, sure, maybe that's a short-term need of the market, but over a long term, as the market matures more and more, is there going to be sort of like a harmonization or a a standardization of what is safety, just as we see in other other products and other industries?
Yeah,
so
I mean,
this,
I think that, again, consistency, safety, efficacy, these are serious concerns for all the consumers, right? They want to make sure that whatever they get, that whatever they're buying is exactly the same as the last time, and that they can, maybe cross-check with a COA somehow to make sure that the product that they got, the batch number, can be clear of pesticides, heavy metals, etc. I think this is step one, right? But again, when you're talking cosmetics or food products, I think when you see made in Switzerland versus made in China, and it's a health product, people will generally gravitate to a Swiss-made product, and I think that kind of adds value to the brand that we've created here in Switzerland. We'll also be producing, in other areas around the world for the biomass, bringing it here and, refining it, extracting it, and then making our final branded products, either in the EU or here in Switzerland to ship abroad. But yeah, I think, it's an interesting question. I mean, again, once you're on the, on the shelves and you're looking at the different products, if one says, made here versus here, people will tend to buy the one that they know that they can have confidence and trust with.
Yeah, and actually it brings up an interesting point too, where when you make that comment that, if it says made in Switzerland, suddenly there's this brand around that promotes safety, quality, etc. But it also might promote, again, costs, more expensive, maybe a very select target consumer group that can afford this kind of product. Whereas when we talk about mass market, usually, again, price dictates more often than not who the winners are. So I'm just, in that respect, curious then, if we're, if we see CBD eventually being a mass marketed product, how will, companies like Cannabis Swiss compete with, what is going to hit the market, and so is that like an advertising, is that an education to the consumer? Because eventually I imagine it will come down to price.
Yeah, I think you're probably right. Depending on the consumer segment that we want to go after, it will be price, it could be price sensitive. We're not creating products to fit the masses. I think, we've kind of found our niche. We're a premium brand. We're going to be selling ourselves as a premium brand with premium products, and with technology that dictates the price. But again, when you're on the, looking at the shelves, let's say in a skincare line, the products that you see on the shelf, the cost of the product is minimal in difference between the one that costs $5 and the one that costs, $500. But it's just a marketing play. And, and obviously there's going to be some key ingredients in there that make it, worth that much more. So for us, it's really about marrying the technology and the efficacy that we're bringing to the market. And it's important that, people have that inherent trust that we're always going to be producing a consistent product month after month.
Okay. I think my colleague here, Andrew, wants to take the next question. Andrew, you're muted, but do you want to unmute yourself?
Yes, thank you so much, Graham, for taking those questions. And actually, I think there's an interesting segue. Both Boris, you and Oliver are strategically positioned when it comes to distribution, right? Boris, in terms of Switzerland being at that 0.1% THC gives you sort of a strategic advantage. And when it comes to price or sort of the efficacy of genetic profiles, you have a little bit more diversity, Oliver, when it comes to sort of that front. So maybe you guys can talk about in the current regulations, sort of the agility that you need, but also sort of the workaround across the EU to move product through countries, both from a regulatory perspective and sort of what's going to make or break a company's ability to distribute their products, whether in bulk or consumer products to the masses.
Well, probably let me start here, just going back to what Grammy said previously. And let me start with that first on price. So right now, the average price for CBD in retail is about 10 cents per milligram. So this means you have a 1 gram product which will retail for 100 euros. It's obscene when our production cost for a gram of extract is $1.50. I think it makes no sense. And if we ever want to pretend the product to be mass adopted, like a vitamin or let's say like omega-3 product, there's no way in my mind that you ever would continue to price the product this way if our production costs are what they are. Now, on your question, Andrew, I think with regards to shipping the product around, I don't understand the Swiss situation well enough, but we fundamentally, you get the ingredients into Germany and then they get distributed across Europe from Germany. And by the time you have passed the importation hurdles into Germany, which is a major nightmare, and you really need to know what you're doing, because you have the narcotics agency involved, a whole number of regulatory bodies involved who haven't got clear rules of how this stuff is being handled. But I think by the time you land the product in Germany, it then flows, I think, from a regulatory perspective, easily within the EU. I think that's not really the issue. I think the issue for people from outside of the EU really is to bring it in. That, I think, is a really complex procedure, and people think it's CBD and therefore it's kind of easy. But I mean, we are finding, at least here in Germany, where we're bringing it in, that it's a very elaborate process. And once you crack that, I think you are on a pretty good path of getting the product shipped around into the other EU jurisdictions.
And Boris, what would you say about sort of the distribution model that Swiss, meaning with Germany being sort of advantageous in that regard, where does the Swiss ability to be able to distribute across Europe sort of come into play?
Yeah, I mean, it's not easy. Switzerland is kind of like a little island in the middle of Europe, and getting our products into Europe, let's say our final packaged goods into Europe, it's a bit of a nightmare. So as you mentioned, Switzerland has a big advantage in the production of hemp, whereby we can produce hemp up to 1% THC with no licenses. This gives us a huge advantage in our production capabilities. But when it comes to distribution of our products, we have let's say an agreement with the Austrian authorities where we can bring in our bulk material into Austria, and then we contract a ISO GMP facility to fill and package our goods, and then we can distribute it legally without any problem into the rest of Europe. So, Switzerland, we use it as a export to the world outside of the EU. And if it's in the EU, then we use, our contract manufacturers within the EU, where we send them our bulk material, we give them the formulations, and then they produce the products for us. But, going back to Oliver's point, about CBD being commoditized as we speak right now, I think he's totally right. And, we were selling, just to give you an example, we were selling CBD isolate for a year ago for, I don't know, somewhere between 10 and 12,000 Swiss francs or dollars a kilo. And now we're selling it, somewhere between 2 and 3,000, depending on the volumes. And that price is going to keep going down to about, we're projecting to about $700 a kilo by March. So that will automatically, take out a lot of the players in the market, because they won't be able to produce for that price. So that's going to be an interesting time, because only those who can produce under that, let's say, $700 number, or even less. I mean, I think it could go down to $400. Who knows? But we're projecting, and this is using some of the most advanced traders in the market, that the price will commodity traders, and I'm talking about worldwide, all sort of commodities. They're projecting to be around the CBD isolate price to be around $700 a kilo.
Right.
Boris, we have to cut you off there only because we're on a schedule, but we do have a question from one of the listeners. Can I connect you with them offline? They are in the CBD business. They're a company here in Canada. Would that be okay? They just have some questions about European distribution, since each nation is unique to regulation. Okay, perfect.
Thank you very much, gentlemen. Yeah.
Yeah, thank you, everyone.
And we'll circle back with introductions, obviously, to speak about your companies at the end of these panels, and we'll pose probably the question to each one in one sentence or less. What are the trends in 2020? But for now, I think we're going to move to our next panel. Thank you very much, Oliver and Boris, for providing those insights on distribution in the European market.
Thank you, guys.
So on our next panel, we're going to focus on Germany specifically, as Oliver sort of obviously stated, that the German market is strategically advantageous. strategically advantageous to getting to the rest of the European market. On our panel, we're going to have the CEO of Nimbus Health, Linus Weber. We will have Finn Hansel, one of the co-founders of Sanity Group, as well as CEO Boris Moskowitz of Alocena. Hello, gentlemen. Thank you very much for joining us on the Germany panel.
See you later. Bye. Thank you.
Gentlemen, good morning. How are you today?
Good, very well. How are you?
I'm doing fantastic. So,
do you understand me well?
Yes, I hear you loud and clear. Linus, how are you?
Good.
I'm good, thank you. Looking forward to the panel with Finn and you, Andrew.
So, to start us off, I'm going to ask a very basic question. I would like to understand your perspective on why Germany is a flower market. Why is Germany strictly looking at flower as the main end product for consumers, and is that sort of the continued trend for 2020?
Well, maybe I quickly start here. So I think it's a bit has to do with history, because the way how cannabis in Germany was medically legalized was basically an alternative to self-medication. So basically, people in the court were actually achieving a regulation or a law finding that basically they were allowed to grow their own cannabis at home. And in that moment, the politics of Germany decided that they don't want to allow that, and they had to give an alternative. Otherwise, the court ruling would have become active. And that is the reason why I think in the first place, the flower was the number one thing that they were focusing on, because the flower was the direct alternative to self-medication and self-growing the cannabis. I think similar to other countries, flowers brings a lot of problems, but also has a lot of advantages. I mean, one of the things with the flowers is because of the broad spectrum of the plant, it's basically very beneficial to do research on a very fundamental base, because you have the broad spectrum, you basically see all the cannabinoids in different kind of strains. And I think that is something that's really valuable. However, historically, that's my opinion why the flower has been dominant in Germany, but that's just my observation.
Yeah, I basically can't add to that. That's totally true. It's a historic reason why we are a flower country, but also in a sense that it's the legislation makes it sort of difficult in a way to easily bring extracts on the market, at least in the pharmaceutical space. But I think regulations will slightly change, will be adapted, and we will find a solution to bring even better products, I would say, than the flower, because I mean, everybody knows that once flower is applied, of course, smoking is not an application method, but if you inhale it, the range of milligrams you get from the active ingredients in the product can be from 0 to, let's say, 50% of the actual ingredients of the flower. And this doesn't make sense. So that's why also a lot of doctors are reluctant to prescribe, and we need to focus on additional intake method, but also on other product design in that area.
And so how far away are we to the consumer being opened up to other delivery systems, formulated end products to provide, true pharmaceutical cannabis?
Yeah, I mean, if I may add here, one thing that I think is specific to Germany is the way how pharmaceuticals are regulated. So basically you have the finished product. For a finished product like a pill or another dosage form, you have to go through phase 3 clinical trials. That normally takes you in between 3 and 7, sometimes 10 years, and costs like around 30 to 50 million euros. The problem with that in cannabis, as you might know, is that cannabis is a natural ingredient, so you cannot really patent it. What you can patent is a dosage form. We see this in Epidiolex, we see that in Sativex and some other medications. However, to go from the pure flower to that finished medication is a huge step. So the question is really, what do you do in between? So one thing, and that's basically, I would say, in my opinion, the next step, is basically to shift the market from the pure flower to the extracts. However, I mean, we talk with a lot of researchers every day. There's no real common understanding in terms of what the different bioavailability is. Some people say that even in the liver, the metabolism system is working in a way that even if you take it orally, the whole THC, CBD, and other cannabinoids is landing in your systems. There are other researchers who say no, actually the majority of that gets lost in the liver. So there is basically a big question of how you can go to the next step of the dosage form, meaning, for example, extracts or nose sprays or mouth sprays or tablets, without needing to do, or with still being an unfinished drug. So what the pharmacist can basically edit in the pharmacies without being a finished drug. And I think that's something where also the German regulation is not very clear. And there's, in my opinion, maybe some people see it differently, no clear guidance yet from the German authorities, from the BfArM and from the BMG, from the Ministry of Health, about how they think they want to bridge that gap between what it is now and what is finished products in the future.
Yeah, and maybe also open a discussion in the area that can we put cannabis in that frames or in those frames? Is
exactly.
it real preparation drug? Is it only a finished product? I would say in both cases, no. So we need to basically find a solution for cannabis at all, which is maybe a third bucket where we can put it in. So a mixture between, on the one hand, the actual preparation drug, and on the other hand, the finished product, which can be given over the counter. Because currently at the moment, and that's why also the prices for the flowers are that high for patients, especially patients on private prescription are looking at that, is that their identity proofs, additional other test mechanisms on the pharmacy level, which are just in a way needed and sort of regulated that they have to do it by law. Having a new regulation for especially cannabis would ease that process and would of course make the products even more competitive to their peers, and which are quite a few.
Mm-hmm. And maybe add one more thing. To be honest, I think the flower or the basic extract, that is a full spectrum extract at the end, has its value, because if you do fundamental research and you want to actually treat a lot of different indications and see how that works in terms of like observing the patient, see if it works or not, it doesn't make sense to have a finished product that's already specified on THC or CBT. For those early indications in fundamental research, it makes basically much more sense to use a first step of the product, which can be, for example, the extract or the flower, in my opinion. So I completely agree with Linus. Ideally, the lawmakers will find a third way. However, you know, we are German and Germans like structure. And if something doesn't fit in the structure, things get complicated. And I think we are in kind of that situation as of today.
And then I guess the obvious question is so the Canadians have taken a very different perspective with the whole vertically integrated model, right? Where you're going to cultivate, you're going to extract, you're going to design, formulate, end products, and then try to distribute. Germany, fundamentally, regulatorily speaking, has taken a very different model. However, my question is sort of where does sort of the advantages and disadvantages for Germany in terms of long-term supply chain with no real domestic supply when it comes to cultivated crop, very strict EU regulations, obviously, to demand that the product be a certain GMP quality, both to its benefit and sort of its disadvantage in commercializing itself. Maybe you guys can sort of talk sort of to that effect, the supply chain current status in Germany.
Yeah, well, sure. I mean, just to be honest, there is domestic production on a limited scale. We have 2 Canadian companies and 1 German company who has won the tender in order to cultivate. So there will be products on the German market in 2021, or some say in the end of next year. So there is domestic production, but not on a scale that can be produced. But if you translate what has been sort of done with that tender, I think it's the direction where the BfArM in Germany, the drug association basically from the government is pushing to, so that pushing away from flower into another direction to find maybe additional products in different ways. So I think if you understand why that tender has been been applied, is that we need domestic production at least to cover some patients, but not for the overall plan of medicinal cannabis in Germany. The flower probably was not the way you want to go. There are several different other things where you might step into. according to the guys who had the panel before us. Also APIs, which might be sort of applied. And then we are back in the, when we're back in the pharmacy, we can directly see that those products can be mixed together in a way to create additional medications. But, and that's why I'm saying, I think it's a clear push into the direction to go away from flowers. And that's also what the head of BFARM said. To cover the amount that will always be needed in terms of flower, I think we have enough from the domestic supply, but we need to step into other directions. So yeah, and Finn mentioned it in the beginning, tablets, suppositories, sublingual tablets, maybe also like active ingredients which can be mixed in a drink, some also tablets which then dilute in water or something like that. There's a lot of possibilities to be used, and this is, I think, the translation of the way how Germany wanted to have domestic supply in that short or low amounts.
Yeah, and I think to quickly add to that, and I think Dino said completely correct already, the majority. So, I mean, it's still a narcotic in Germany, and that's the reason why you treat it as a narcotic. So it means basically the processing of the product after it gets harvested is very much regulated of what you are allowed to do and what not. I actually think a market disadvantage compared to Canada. However, I mean, Germany has very high quality standards, and that's the reason why I think it's also a bit of makes sense to have a different regulation here. However, it's still not clear in what form it will get, because if you think about other dosage forms like some sublingual tablets, it means someone needs to process the flower to the extract to the tablets, and the question is who's doing that. In the current legislation, theoretically only the pharmacist can do that. The question is now if they will allow companies like us or Nimbus or others at some point, if you have the right licenses, to also do one procession step further. But that's at the end, at the moment, not really clear according to the regulation.
Well, gentlemen, I think that actually we're moving quickly and we're covering the market well. I actually want to start to open up the point to introductions to discuss sort of your companies individually, and we'll invite Boris and on the panel back. If you don't mind, sort of Linus starting and introducing what Nimbus Health is, who you are, and we'll move forward from there. Thank you very much, gentlemen, for answering my questions.
Okay, yeah.
Okay.
Okay, well, I did the introduction as well, but for the ones who have now joined, I'm more than happy to introduce my company again. So I'm from Nimbus Health. I'm the CEO and founder. We are a fully licensed pharmaceutical wholesaler in Germany. We have our own warehouse facilities and an independent sales force to promote cannabis-based products to doctors and pharmacies. Our mission is to supply seriously ill patients with highest grade medicinal cannabis products from basically reliable sources who can bring products to us in a consistent but also sustainable way. In addition to that, we are offering training and education to doctors through our partners, but also in our own documents to bring the best or develop also the best therapies here for the German and the European market. For this, we are also actively seeking advice and working together with the biggest cannabis pharmacies network in Germany. And in this context, also, we are striving for standardization, professionalism, and expansion of the cannabis market and the cannabis market as a medicine. And this goes hand in hand with research in the biotechnological area, as well as the development of new application methods. Thank you very much for having me, and looking forward to the next conference.
So shall I continue?
Go ahead.
In the beginning, I'm the founder and managing director of the Sanity Group. We founded the company last year. The Sanity Group itself is a holding company, so we consider ourselves a holistic cannabis company. We are based in Berlin, Germany. One of the major pillars of our holding company is Sanatio Pharma. It's a fully licensed medical wholesaler, very similar to other companies in the market like Medical, to a certain degree Nimbus. and basically fully operational. Then we also have a second pillar that is more CBD cosmetic products and CBD products being used as topicals in the, we don't say medical space, but in the pharmaceutical space. And then we have basically further units under the Sanity Group. One of them does clinical trials to basically develop finished medications. Another unit is basically researching alternative dosage forms. And another unit is basically sponsoring clinical research and university research to basically make sure that the fundamental research in cannabis is basically done. And basically what I'm always saying, we almost do everything except for cultivation. That's a conscious decision because in my personal opinion, I don't really believe in the German cultivation based on the structure we have and what's happening in Portugal and Spain right now in terms of how the prices develop, similar to what we heard earlier in CBD. However, that's probably a philosophical discussion. So, but basically Sanity Group is doing everything except for cultivation.
Okay, now with regards to myself, I founded and I run Volumed. Volumed is a medical license producer, which combines low-cost cultivation and extraction in Colombia with pharmaceutical assets in Germany, where we have teamed up with one of the leading narcotics contract manufacturers here in Limburg, which is where I'm currently at. And fundamentally, our mission is to provide safe, efficacious, affordable, and ecologically sustainable cannabis medicines, both in the CBD and THC side to the market. We believe this is a major gap right now on where the market is, and feel that combining pharmaceutical capability with low-cost sourcing, I think ultimately lends us, hopefully, we believe, with an advantage with regards to competing with people who are not vertically integrated and don't have those benefits.
Gentlemen, thank you very much. That's the completion of our European panel. You provided direct insight. I think we'll be moving on now to focus on the Canadian market. Thank you very much, gentlemen.
Thank you very much.
Thank you. Have a good day.
Awesome. How is everyone?
Doing great yourself.
Good.
Good.
Okay,
Hear
so
me?
yeah. We'll kick things off just to stay on schedule here. So the Canadian market, we just celebrated our 1 year for REC. There was a lot of speculation this time last year on the edibles market as it wasn't included in the initial Cannabis Act. With Health Canada recently releasing what's, I guess, been coined legalization 2.0 with a lot of focus on edibles. I just want to kick things off, and maybe we'll start with Sandra. Sandra, what are some of the key points that companies should know with respect to legalization 2.0 in Canada?
That's the introduction of the cannabis edible market. I think one of the things to be most concerned about are the rules and regulations and restrictions around packaging, labeling, promotion, and branding. The earlier legislation, the Cannabis Act, which was passed October of last year, carried with it a number of significant restrictions and rules around branding and advertising and promotion. Those are equally applicable to the cannabis edible market as well, with some new restrictions. For example, there's new health warning messages which must accompany the packaging in relation to the edibles. There's also new standardization quantities around THC, CBD, childproof packaging, that's still the same, and limitations on the size of your logos, for example, in text on any kind of promotional activities. I think in addition to the packaging and the labeling restrictions, no bright colors, no health claims, no dietary claims, no nutritional claims, no cross branding, and that's one of the biggest things we're seeing now in relation to the alcohol and tobacco interest in the edible market. For example, no reference to Chardonnay or IPA brands, those sorts of things. So wherever you see a restriction in place in relation to your packaging and your labeling, those will also apply to promotions. Or basically anything that's appealing to children is prohibited. So no appealing flavors. There's no sugar, no alcohol, no nicotine, no caffeine, no promotion. But one of the biggest improvements, I think, or latitude that Health Canada has given is that now packages will be allowed a peel away label. And so now industry can put in informational or information within those appealing labels.
Okay, thank you. James, Hexo has a dog in the race, no doubt. You know, you talked a bit about trust beverages. What's Hexo's view, or even your personal view on these new regulations?
Well, I mean, you know, the new regulations they are what they are, right? And that's the world that we live in. It's a very tightly regulated environment. We have to always be concerned with making sure that, you know, first and foremost, we stay 100% legal. And then, of course, then, you know, the next thing that we're 100% concerned about is the safety of our consumers. But really, when we look at this, we want to be able to provide a product that consumers can identify with. So, you know, ideally, in a perfect world, I would love to be able to have, you know, more freedom from a point of view of labeling and more freedom from a point of view of branding and being able to communicate the product, right? How fantastic the product is. You know, when we come to beverages as an example, it's a great way to be able to normalize cannabinoids and the use of cannabinoids, whether that's a THC product as a, you know, as a relief, you know, from the end of the week type of thing, just as we would consume alcohol, or to CBD product that provides the ability to be able to, you know, have some form of a recovery from a sports event or from, you know, some form of strenuous activity. The environment that we work in is one that, you know, we have to comply with all of these regulations. And I think what really comes down to it at the end of the day is consumers are going to choose the products that they feel comfortable with, you know, the format that they feel most comfortable with. And then at the same time, they're also going to lean towards those products that give them that fantastic experience, right? We always talk about the way to bring products to normalize them as being, you know, make it a simple, easy experience for the consumer, right? Make it simple for something that they're already familiar with. When we talk about beverages as an example, you know, we want to make that a normalized experience. We want to make it something that is similar to the experience that they've had perhaps with alcohol, so that there's not ability to be able to consume multiple beverages, right? As opposed to some of the beverages that you might see in the States where there's, you know, a huge amount of milligrams, you know, on a per bottle basis. We don't want the consumer to have one and be done. We want the consumer to be able to enjoy that product over a period of time. And I think that's where we're going to see the Cannabis 2.0 products evolve towards, right? Is that ability for it to be normalized and be easy for consumers to use.
Thank you. Paul, you didn't get a chance to introduce yourself, so do you want to give 60 seconds on who you are, and then maybe segue into, you know, whether or not, if you can just educate maybe the audience a little bit, whether there's max requirements for THC in the new edibles and the regulations.
Perfect. Paul Peterson, co-founder, CEO of Next Leaf Solutions. We have been around for about 3 years now. Our focus has been developing disruptive intellectual property around extraction, purification, and formulation of cannabinoids. Currently own a portfolio of 8 issued and over 40 pending patents around the production of THC and CBD distillate, which we think is the precursor for edibles and beverages and all these 2.0 products. We really believe that for 2.0 products to be successful, especially beverages, that the experience has to be good. And when you talk about experience, really 2 things: onset time and taste. We think that, you know, traditional infused beverages, if you go down to the United States, I think across the board, they're terrible. They're terrible because they're manufactured with a less refined THC molecule. So you taste chlorophylls, you taste waxes, and you know, you get that plant taste. So that's the first problem. The second is the onset time. We've been very focused as a company on developing and acquiring technology that we think is going to fix those 2 problems. So first, we believe that when you start with a high purity molecule, you start with a tasteless, odorless distillate, you're going to be ahead of the game when it comes to taste, and you're able to flavor it, and consumers not tasting the fats and lipids. 2, we've been very focused on a technology that we've just recently acquired. It increases onset time from about an hour and a half down to 10 to 15 minutes. We think that's a quantum leap for the industry, because I think, you know, to compare it to alcohol, if beer took you an hour and a half to feel the effects, beer wouldn't be as popular as it is today. So that's those are kind of, you know, 2 big problems that we're working on. Just very excited now for the opportunity with all the 2.0 products, and we think that you know, it's a whole different skill set as a company. I think the last 5 years, the industry has been about growing plants and how many millions of square feet you have. And so now I think getting into the 2.0 products, it's all about technology and manufacturing capabilities and companies that can win on cost, because I think that's how the legal market beats back the black market, or the illicit market I guess is a better term, is being able to win on price. So that's sort of our view of it.
Interesting. Okay, you brought up very interesting points. I mean, 2.0, it sounds in your view that the focus is now going to be on the technology, rather than, this time last year, a lot of it was about cultivation and companies, getting new licensing. To pass it over to Sandra. Sandra, when you see these regulations, what are some trends that you are seeing on your end that, are some messaging coming from Health Canada, especially with how they see the future of the cannabis industry here in Canada, especially to James's point, when brands can't tell their stories and, and they want to get access to the consumer. What's Health Canada's, more or less, what's the message they're putting out there based on these regulations?
I think first and foremost, Health Canada is going to be concerned about health and safety. It's always been about the product and ensuring that the consumer has a safe experience, its quality across the board, its consistency, and it's, when the task force initially developed the first set of regulations, they were guided by a set of principles, and those principles, focused on safety of products, safety of the individual, preventing young people from accessing cannabis, whatever product that may be. So if it was the first set of cannabis, or the first forms of cannabis, whether it was dried, flower, fresh, now we're going to see the same regulatory framework, the same restrictions moving into the edible market. I think that appears to be their focus, right? And I think as new products come on the market, they're going to approach it very carefully, and that's why we're seeing a stepped or a graduated approach into allowing certain products onto the market, and restrictions around those ingredients that can be used, or infused into these products until they know what those products will do, or how they will affect an individual. And you're also seeing that in relation to the inability to make any claims associated with any of the products, whether it's a CBD product, or if it's a dietary supplement, or if it's a therapeutic claim in relation to a CBD. They're just very cautious as to what you can say about the product until they have more scientific data to back up and substantiate these claims. And this is what you're sort of seeing, I think, in the vaping market now, is the uncertainty around, inhaling some of these products into your body and into your lungs, and what that may actually do. So they're just approaching things cautiously, and I don't think that's the wrong thing to do.
Thank you.
James. Just want to add one point about the vapes just quickly. I think one thing very important to point out, though, all these issues with the vape products, we're not aware of one instance where there's been issues from the legal vape products. These are illicit products, and I think they also speak to the need for regulation. And obviously, Canada, vape products aren't legal for sale till the end of the year. And what we've seen in the United States is products that come from the illicit market that are unsafe because they're made in unregulated environments with carriers and so forth. So I think it's going to be there's going to be even more focus from Health Canada on the products that producers put forth to have approved.
I would agree for sure. James, I know you're heavily involved on the M&A side for Hexo. So you're out there scouting new opportunity. What's the new opportunity that you see in legalization 2.0 from an M&A business development standpoint?
Yeah, so I've really got to agree with Paul in that the market has changed very quickly over the course of the last year and a half to be focused around technology and around what can we do next, right? We've said now for a number of years that we don't intend to be a cultivator forever. Winning at this game as a cultivator, as a farmer only, it's not going to make it. We need to look to where are we going with this product. Being a cultivator today is important because it's a barrier to entry. It's a first step in the Canadian marketplace. But as we move out into other marketplaces, we look to expand into the US or into EU or into to Latin America, it's about the technology that we need to leverage. And that technology is not only in delivery of the beverage, but it's going back to, again, to Paul's point, it's starting off with that perfectly clean, pure substance that we're now going to formulate with. So we're constantly out there scouting for technology. We're looking for new opportunities to be able to reduce onset time. But at the same time, it's not just about onset time. We're spending a lot of time worrying about offset as well. If the consumer is looking to be able to have an experience that allows them to be able to ideally feel the effects of the product within 5 minutes, I mean, that's really where we want to run towards. We also want to be able to predict what that offset is going to be. You know, that consumer is not going to want to experience a gummy that onsets in 5 minutes, but then offsets in 8 hours, right? And maybe some people do, but realistically, we want to be able to have it predictable, right? So that we do know what the time frame is going to be. So we spend a lot of time worrying about that. We spend a lot of time worrying about the type of technology that allows for the product to be that absolute, perfect, consistent consumer packaged good type of an experience, right? Every time I go to the shelf and I pick up that cookie's got to deliver that same experience, you know, time in, time out. Same thing when every time I have that vape experience has got to be same thing, time in, time out. Our formulations that we're working on are leveraging those technologies to be able to deliver that experience, right? Whether that's an experience of being able to help you sleep, an experience of being able to provide you with euphoria, or an experience that helps you to be able to be calm, whatever it may be.
Interesting. I mean, and I think that's one thing we can say for certain is one of the opportunities for companies looking to access the Canadian market is, you know, an import of technology. And maybe Sandra, I'll pass this over to you. What is the likelihood that Canada will, you know, when we talk now about flower, an actual product, is there some, you know, are we seeing any rumblings from Health Canada, any signs that, you know, Canada will improve import access of products into Canada?
I think that's the $50 billion question at the moment that everybody seems to have. You know, our regulations and our legislation allows for the import and export of cannabis. It's there, it's clear. It's for medical and scientific purposes. You know, the information that we have is that, you know, even for importing for R&D purposes, it has to be medically focused, you know. Having said that, why are we not seeing much import, you know, from other countries where they are producing? We have seen some product coming in from Jamaica, Colombia, Israel, you know, but not in any commercial scale. So I guess the question really is this a supply and demand issue? Is this a product safety issue? We're not quite sure exactly where Health Canada is coming from because we don't have any policy around that, you know, legislative framework that will say, you know, we're going to allow in certain products from certain countries. I have no answer to that one. I wish I did, but I think it's a problem or a challenge that Health Canada is going to face when industry is looking at cultivating and growing in other jurisdictions as part of their global strategy. And I think there's going to have to be some further clarity in the future.
Okay.
I mean, it really is a commercial aspect, right? You know, you touched on it there for a second. There's got to be a commercial requirement, right? And the fact that it's for a medical purposes only, the medical marketplace in Canada is still relatively small. So the current cultivation assets that exist in Canada can supply that without the requirement for additional demand. If we look at it for ourselves, our medical business is only a small portion of our overall business. The majority of our business is really focused in on the adult rec, and adult rec is where 95%, even greater, of our volume goes to. So we don't have a need necessarily to be able to import. Having said that, as the Canadian medical market grows and we get into an environment where perhaps CBD becomes less regulated and is now more commercially available on broader distribution shelves. I mean, let's be real, right? Today, the Canadian marketplace only has 500 some stores. 208 of them are in Alberta, right? 60% of the marketplace only has less than 100 stores. You know, so access to the product is limited from a recreational side. From a medical side, it's still going through normalization. We still don't have enough doctors that are out there, you know, readily prescribing and really using it, turning to it as a form of therapy. So, you know, the market's still got to develop. It'll take some time.
Mm-hmm. Agreed. Okay, so we do have a question from the audience. This is from Boris. And I'll just read it off, and maybe Paul, I'll send it to you first, just see if you have an opinion on this. So in your opinion, we will see that the nutraceutical OTC category evolved following the latest consultation by Health Canada for non-practitioner oversight. If we do see that coming, what expanded role for pharmacists will we see, and do we think we will move to adapting cannabis to scheduling as per NAPRA regulations, or do we think that new regulations will be needed to be created in order to allow cannabis products into the space? For example, cannabis health product number versus an NPN versus a DIN. And I'm not sure, Paul, if you have an opinion, or maybe Sandra.
Yeah, no, I think great question, and James had sort of alluded to this a moment ago. The cannabis health products, which the government, I guess, put out for comment back in June, is very, very significant, because we believe that if Health Canada says, okay, low risk cannabis products, which we would assume they would mean CBD only products, or very low THC based products, could be sold kind of over the counter like vitamins. We think that has the potential to really fix the distribution problem that James is talking about. I mean, there's a lot of challenges that the legal industry has right now, and the reason that the legal industry is maybe 10% of the total, supplies 10% of the total cannabis market is the biggest problem is there's not enough distribution. So if you could sell CBD based products kind of in every Shoppers Drug Mart across Canada, for example, that would change, at least for CBD based products, the distribution. And we think it has the potential to really blow the lid off this industry. And at the end of the day, I think CBD is certainly a phenomenon. I've seen it being in this industry the last 6 years on the medical side. I was previously at Peace Naturals, and CBD oil over the last year has been very popular, recreationally, and we think at the end of the day, consumers want to buy legal products. It just comes down to having availability for those products, and obviously regulation and a lack of retail is a big reason for that. And as far as DIN numbers go, I think the challenge we've seen it with GW Pharma, and I think maybe we've seen 2 drugs now with DINs in the US. The issue is cannabis flower will never ever have a DIN number. Right? The reason is because it's not standardized. When you grow lots, there's too much variation. Where we're going to see DINs is an oil-based derivative products that you can standardize for dosage and have the same amount of cannabinoids, the same chemical profile from lot to lot and drug to drug. So I think we are going to see cannabis-based drugs with drug identification numbers, DINs, in Canada. Is just again, it's going to be on the oil side, and I think. I don't know how much of a focus companies are taking on that, but it's certainly an area I think we'll see growth in.
I have to agree with you, Paul. The regulatory framework around the CBD products is lacking, and the consultation paper put out by Health Canada, recognizes that there has to be a new pathway in relation to CBD products with a less than 0.2 or 0.3% THC, and so it'll be interesting to see what comes out of that, because if you look at even just the World Health Organization, they clarified very recently that, anything CBD derivative, is not regulated on the international arena like a narcotic or cannabis is scheduled on the international drug treaties. So, if that is any indication, that CBD, based on their scientific research, is not harmful to Canadians, why is CBD regulated the same as cannabis containing a high THC content, right? So, there has to be a new system developed for these kind of products in order for Canada to compete or even maintain its leading edge in relation to that market. I mean, we see the US, for example, even though cannabis is illegal federally, they've now passed, the Farm Bill, which allows CBD products derived from industrial hemp, legal federally, which allows for interstate commerce, and it allows for importing and exporting. As soon as the FDA issues their regulations in relation to the CBD derived from hemp, then that market is completely opened up, and Canada will be at a disadvantage because the CBD that's even derived from industrial hemp plants are regulated the same as cannabis with a high THC content. But it just doesn't make any sense in the market.
Thank you, Sandra. On that note, I have to wrap up. We need to move on to our fireside chat with Alex. First, just to conclude, thank you, James, Sandra, Paul. Really appreciate your time. Perfect. Alex, how are you?
Good, Grant. How are you?
I am well. And just before we kick off, I just want to let the audience know, I think just because we are running a bit behind schedule, we might cut the break a little short. That way we can kind of pick up that time towards the end of the conference. But, so segueing now, Alex, we're going to be talking about international investments and capital and some of the challenges that the equity markets are seeing. So just to kick things off, what are the common challenges in completing an M&A deal in the cannabis industry today?
There's a number. We've seen a lot of M&A activity last year, especially since after legalization in Canada. So 2018 was a very busy year, a lot of deals being done. 2019 also started pretty busy. We've noticed a bit of a slower period now, starting in September or in August. But there's a number of challenges. Looking at a target that's involved in the cannabis industry, there's just so many issues that these companies touch. So it's really important to have an advisor or a legal team in that local jurisdiction where that company is domiciled that really understands the laws and the regulation and the rules relating to what's required to operate a cannabis business. If it's a cultivator, if it's a house of brands, if it's a company that's focused on IP, or if it's a company that is affiliated with others or just does business with others that are in the cannabis industry, it's really important to understand what laws they are subject to. Are there contracts that they entered into? Are they compliant with the local laws? IP is very important to understand that they own the brand that they're promoting. If they're a cultivator, are they licensed properly? So the cannabis industry just permeates so many different areas of law that it's the most important challenge is getting the right group of people in here that really understand the local framework of the target that you want to acquire. And I'm saying this from the perspective of a buyer in an M&A transaction. In terms of a seller, it's making sure that your financial documents are properly organized. You have the right controls, that your contracts are readily available for due diligence review, and just basic corporate cleanup and corporate governance, which will be important, especially in this day and age.
That's interesting. And I wonder, are you speaking a little from experience where, are you seeing clients coming to you without, having tried to more or less do it on their own and realizing, wow, I have no idea what's going on in a regulatory framework here. I need help.
Yeah, that's very common, especially, and it's not just cannabis. It's any emerging industry. You have people that, with good intentions, trying to start a business. They have a great idea, but they have never run a business before, and they have a lack of experience in proper record keeping, proper corporate governance, or what it takes from a legal perspective to manage and operate a business that's compliant under law. So when we get involved, it's possible, and I've seen it, that these companies have been operating for years, but they really haven't had proper counsel in advising them to prepare their documents a certain way, to have proper record keeping, and that's very important, especially if they want to raise money or if they want to start going through an M&A process with a buyer or seller.
Interesting. And then, so maybe that actually brings about the next question. So, with all the options available for cannabis companies to become funded, where are you seeing some of the more successful trends today? Like, how are these successful cannabis companies being funded today?
Well, it really depends what stage the company is in, and I've seen companies in all sorts of stages, from a startup to a company that's just started to generate some revenue, and then there's companies that are ready to go public, and then public companies, how they finance. It's really getting their good friends and very close business contacts and getting a seed round together so you can take the company to the next stage. Once you get to the next stage, you see more sophisticated investors that would ask more serious questions about where the company is going. I want to see your records. There's a due diligence process. Often they would ask for a board seat for the company for a number of years. The private company then evolves. Maybe there would be some help with an investment bank in raising some money. And then eventually the company gets to a certain point where they're starting to hit a wall with their options for investors in the cannabis industry, and then they would look to going public. And that's a very long and can be difficult process for a lot of companies. But we've seen a lot of go public transactions last year in the cannabis industry, especially from the US coming to Canada on the Canadian Securities Exchange, and a lot of listings on the TSX Venture as well. So that's what's unique about Canada. There seems to be a lot of activity with foreign companies trying to raise capital in Canada. And at Miller Thompson, we've advised a number of companies that have gone through that path of raising money privately and then going public.
Interesting.
And then once the company is public, it would be a bit easier for them. It depends on how the market's doing in doing a brokered financing, preparing a prospectus to do a public offering. So there'd be there'd be advantages in that respect, being a public company, in having more options to raise money.
So for any companies on the line now that, has considered an IPO on either the CSC or TSX, do you have maybe one piece of advice you would give them that they should know now before heading down that road that might at least help alleviate some of the challenges that you've seen in the past with other companies?
I would say the most important is to make sure that your financial records are done properly, you have proper controls, because a challenging aspect of going public is to go through an audit. And that audit could take a couple months, it could take 6 months, it could take even longer. So it's important that you have those records cleaned up, and so the auditor is able to understand them, because it'll go a lot faster. And a second element would be your just record keeping in terms of contracts, having that all organized, because if you're going public, more often than not, there would be a broker involved. They're going to want to do due diligence. So they're going to want to see all the records for the company. And then, obviously to make sure that, if you're a licensed company, depending on where jurisdiction you are, that the license is in good standing, because that's something that part of the due diligence process, the broker or the auditor even is going to want to confirm. And we've been seeing that auditors and brokers have been asking for legal opinions on whether or not the license is in good standing or not.
So I have a question actually that just came in from the audience. So in your opinion, how does the massive slump in LP stock prices affect the fundraising options for private companies?
Well, it's a huge, it has a huge impact. We had a tremendous amount of activity in 2018 and 2019, and the markets unfortunately have gone south a bit, and there's been a bit of a correction on the share prices for a lot of the companies. So it's like any market; it's going to go through ups and downs. Right now, we're in a bit of a down market. It is challenging for companies to raise money. even for public companies. But there's a lot of opportunities now. There's with Cannabis 2.0, there's companies can diversify. They can look at their business plan and make some changes. And then I'm confident that investors will come back to the table, if that later this year or early next year. It's just the changes in laws right now is going to, I think, spur some activity from non-traditional players in the cannabis market. If it's with new cosmetic companies, new beverage companies, and I know some have been already involved, but I think with the changes in law and bringing edibles and topicals and other derivative products, I think it's going to bring new players to the table, and I think that's going to spur the financing activity for the cannabis industry.
There's a lot more we can talk about on this point, because I think it begs a lot of questions as well with respect to institutional players, and when we start to see them play more an active role, and whether or not that's a conversation specific to Canada or the US or global in general. Alex, I want to say thank you, and we really appreciate your advice on all this, and your colleague Asim, I would, if I can now turn the conversation over to you.
My
just
pleasure.
as we're,
Thank you.
Yeah, thank you. Asim, just to kick things off, tell me a bit about yourself and your area of focus.
So like I mentioned, I'm a restructuring lawyer primarily. So I help companies or lenders, in this context, lenders deal with troubled loans and how to get their money back in a difficult situation. Ideally, in the best type of situation, you lend your money, they make their payments, and you get paid out by the maturity date. Oftentimes that doesn't happen. And what we're seeing is with the equity markets drying up a little bit in the cannabis space, I think there'll be a lot more focus on debt and raising money through debt. Companies still need to finance their operations, and those are really the two options that they have. So I think what we're seeing now is where I would help is a specialty is to help companies get their money back, but what it really does is inform kind of what are some of the issues that come up in this space when you are trying to get your money back when the debtor has defaulted on their loans, and what are some of the risks that you face, and how that might inform your lending decisions at the front end.
Yeah, and I guess to the last conversation there with Alex, when we talked a bit about the slumping stock prices with the LPs, are there some issues lenders might be facing currently while lending to these LPs as a result?
So when we look at, there's very few public situations. For example, recently a receiver was appointed over one cannabis company, and Miller Thompson actually acts for the receiver in that one. And there's been one, it's called the Companies Creditors Arrangements Act, or the Canadian equivalent of Chapter 11, and one company went through that recently. But when you look at the Cannabis Act and what's in there, and when you tie that with how you would typically enforce debt, which is taking control of the business to try and either sell the business as a whole, or sell the assets piecemeal, or operate the business in order to get your money back. So some of the issues that do come up is when you're trying to get your money back in a cannabis space is, well, what is your collateral? Like, what are you actually allowed to touch? So for and what are you actually allowed to sell? So for example, the cannabis, if you're dealing with an LP or a retailer in that regard, especially in Ontario, the license itself, it's not clear, it's expressly not transferable in the retail context, and it's highly unlikely, the act is silent on it, but it's highly unlikely that a retailer, a licensed producer's license can be transferred to a third party, and practically speaking, it's impossible, because Health Canada on the back end can just, if they don't like who you're dealing with, who the purchaser is, then they're just going to terminate that license for one reason or another. Another point is that an organization cannot have possession of flower. So when you appoint a receiver, they're not a licensed producer. They don't have a cannabis license, so they don't have the ability to actually possess the flower or sell the flower to anybody, including another licensed producer. So you can't really look to the flower. And in the examples that we've seen, Health Canada has required the destruction of whatever flower is in the distressed business. So again, when you're looking to get paid back, and if you're lending and you're in factoring in the value of the collateral that you're lending against, if you're factoring in the license, the value of the license and the value of the flower, you might find yourself in a problem at the back end if you ever have to take over and actually take an enforcement step to find yourself repaid. Also, another thing to think about is during a loan, the Health Canada actually has broad powers to seize assets in the event of a violation of the Act. That includes, obviously the flower. There's one example right now, a famous one of CanTrust, where they were, growing illicit or I don't know, in contravention of the Act. They were growing flower that they shouldn't have been. And that got subject to seizure proceedings. And they also have the ability to seize, the equipment that you use. So let's just say, in an example, that the contravener was, hiding flower inside the equipment or under the equipment that could be subject to your collateral and otherwise may have been able to be sold in a normal process, is suddenly stuck in this proceeding by the government in their investigation in the context of them enforcing the Cannabis Act. And another thing that to think about is what is the effect if someone were to appoint a receiver or commence proceedings. You usually start with what's called a stay of proceedings, so it's like a pause button, stops anyone from doing anything to allow the company some breathing room to figure itself out and restructure its affairs. Some of the issues that you face are what is the from a legal perspective, what strength and teeth does that stay have in the face of Health Canada taking steps? And we think very little. So from that perspective, when I say what is your collateral and what are the issues you face, what you really need to be thinking, what is this stuff worth? And when I'm lending, how much money am I lending? Because if I need to get it back, what can I actually look to get paid back? And what do I think that is? That's probably your real property. That's probably the building upon which everything, the facility is constructed, the building that's constructed on the property. It's probably, assuming the Health Canada hasn't seized it, it's probably the equipment, the actual, like the lights, the growing systems, the infrastructure, that type of equipment. But it would probably is most likely not, is your actual flower and your actual license. So those are, when you're lending, you shouldn't be factoring those in your lending decision at the front end. We do see some potential wiggle room if in a situation where you have the support of Health Canada, you have professionals in place that know what they're doing, you have some credibility that you can gather the support of Health Canada and to help facilitate the restructuring of a business. There is potentially some leeway that you might be able to realize on assets, but in terms of a lending decision at the front end, we wouldn't advise to bank on Health Canada playing ball with you in an enforcement scenario at this current circumstance.
So it sounds extremely risky.
Well, it's risky in the sense that if you're lending against flower, it's very risky. If you're lending against a license, it's very risky. If you're lending against the other things I mentioned, equipment, to me that sounds more like traditional financing, with some added risk because Health Canada has these powers to seize property that you might otherwise face in a typical industry.
So would you say, from a strategy standpoint, in order to mitigate the risk, it's more you have to be a lot more strategic in what you're actually lending against?
Yeah, exactly. You have to be very careful and really do your due diligence in terms of what you're lending against and what the value of that collateral is, and making sure the money that's going out the door is consistent with the liquidation values of this collateral. It is, specialized products. It is specialized equipment. So there's a more limited buying group that's available, which could, depending on what it is, it's likely to depress the price of something when you have a limited buying group. One strategy that I've seen that we saw in this receivership case especially is a lot of times one security item that you could take is a share pledge. So you could take as security a pledge of the shares of this company, of a cannabis company, and then use that share pledge to kick out, the current management team and replace it with your own. That creates some issues in terms of, you need to make sure that Health Canada has signed off on those people. Otherwise, again, you could lose your license, and what are you doing if you don't have a license? But it's also, depending on what type of lender you are, that might impact whether you can take that step or not. We were at a financial institution doing a similar presentation, and going through that, it makes, the thought is if you're a big financial, institutional financial institution, and like a bank, and you have operations across the world, chances are your executives might run into problems crossing borders if they are the owners of a cannabis company. That could be an issue for them. But in the context where I've seen it, be reasonably successful here, is where the ultimate lender is a private alternative lender, someone who's like a private equity company that's in the cannabis space already, and they have a portfolio of cannabis companies, and they're willing to take those risks because they're less concerned about these border issues and things of that nature, because that's their business. I've seen them enforce on shares to try and take over and leverage their relationships with Health Canada to get relicensed and to get everything they need to run this operation and have a smooth transition. So, I mean, for the private debt market, I think there's maybe some more options and strategies to be creative. For a big financial institution, I think you're more restricted, just given the magnitude and the international scale that you're dealing in. So I think that those are some strategies that you could use depending on what type of institution you are and what you're trying to accomplish, what your end game is.
Awesome, that's great, and I think that helps even set expectations for the cannabis companies, when they go into these situations and look for lenders. I want to thank you for your time. We do have to move on to our next panel.
Thank you.
Thank you. Okay, well, maybe for the sake of time, we will just continue on, and then when Sanjay jumps in, we'll start directing some conversations or some questions his way. So 2020 market outlook. First and foremost, Brad and James, thanks for joining.
Being here.
How important is intellectual property in next year's market? And maybe just because we haven't heard from Brad yet, Brad, would you like to kick us off?
Kick it off. Yeah, I think IP is always going to be important, right? I think what you're seeing is an interesting evolution in the cannabis market right now, though, where if you go back a few years, we had this euphoric trade where anybody who was proposing to be a limited producer or a licensed producer, anybody who was developing anything in the cannabis space got caught by this euphoric trade and supported by Canadian retail. And what's happened is as we got into legalization, and specifically through the first year of legalization, we're now in a period where the investment community is looking for businesses to be able to demonstrate revenue, that they're hitting their financial milestones, and that they're developing some sort of moat around their business. Looking forward into 2020, I think, and 2020 and beyond, because I think this is a big industry that we're just in the early days of it getting going. You're going to see companies that have scale of production and that have distribution capabilities are going to be ones who can establish a leadership position in some ways. Companies that have branding and more on the customer management, customer distribution. And then you're going to see a big focus on IP, and specifically around, as Paul was talking about, specifically around what delivery and dosage mechanisms look like, what efficacy looks like, how do you prove that a topical cream works for something that helps with sleep. We need to get into the science of that, and that's where the real IP is going to start to come out too.
James, I know for you, and you've mentioned this on the last time we had you on here, intellectual property right now is a focus of Hexo. But when you would say for your, a day in the life of James, how much of your time is spent thinking about specifically acquiring intellectual property?
It's funny you ask. I actually, as soon as we wrap up here, I jump right into an IP meeting.
Well, there you go.
Portion of what we do. We actually have a group on our industrial design and engineering team that are focused just on IP development. And the IP development for us is, both what we are, what we're trying to develop and create ourselves, but also it's what I was talking about before, that technology scouting, where we're looking to do M&A activities or licensing activities with organizations. We currently have about 38 patents, I believe it is, at the moment, that are currently, going through the process, the approval process. A couple of those have been granted. Unfortunately, patents they don't happen overnight. But we're constantly looking to be able to increase that capability. Now, the debate is always, how much of that do we want to patent versus what do we want to maintain as a trade secret? So it's a lot of, it's a combination of different strategies to be able to make sure that we've got everything covered. But absolutely, it's a huge portion of our business. We think about it on a daily basis.
So I just got a message. Grant Thornton, we're working to get them online. They'll be online shortly. Jess is working on that. But just to kind of continue with the conversations, so maybe then I'll bring this back to you, Brad. From your perspective, TSX, you're speaking with companies all around the world that want to list in Canada, access to Canadian investors. Do you suspect we're going to see an increase of international activity coming to the TSX, or have you already seen that, and that's sort of the trend that we're seeing in the market today?
That's an absolute that we are seeing. We have been seeing it for some time, and we continue to see it going forward. When you look at where the next phases of growth for this industry come from, it is we've got 5 companies from Colombia listed with us now. You look at what's going on in Europe in terms of legalization. We're in a global environment where you've got a dynamic regulatory regime that's tied to each of the different geographies. And I think what's really exciting about Canada is because we were first in this space, because we were able to get these companies listed earlier here, we have the most sophisticated pools of capital active with us, and specifically on TSX and TSX Venture. We have the most sophisticated pools of capital active with us. We have companies that have critical mass and access to those pools of capital to be able to make acquisitions and move opportunistically as different geographies start to legalize. And then we're here to support that. And so I think what continues to be exciting is if you look at what happened in the mining space, for instance, the reason that Canada is so dominant as a mining jurisdiction and a mining finance jurisdiction is because of the TSX Venture and the way that public venture capital has facilitated global companies to come here, access money, drill programs, and then grow. And so when you look at 5,500 projects that are under exploration and development within
Thank you, Jeff.
So when you think about the decades of the junior mining space that grew up here, and the fact that we have 5,500 projects under exploration and development between the two markets, the TSX and the Venture, over half of those are located in international jurisdictions. And I think we're seeing cannabis doing the same thing now. That Canadian management teams, Canadian companies that have access to capital are able to move into these new geographies that are starting to legalize. And then, you talk about IP, but the know-how of being able to comply with a government regulatory body, to be able to demonstrate quality control, to be able to, meet various government requirements, I think that's what will continue to open those doors for Canadian companies.
Oh, great. Okay.
Thank you. Brady. Sorry, I think I've been saying Brad. Brady. Thank you.
Brad, Brady, Fletch, all works.
All works. Sanjay, let's get you involved in this conversation. When we're talking about 2020 market outlook and perhaps maybe some trends, what's Grant Thornton seeing right now? Like, what's coming through your door? What, based on what you saw in 2019 and now that we're towards the end, what could you tell the audience right now that is something unique that you're seeing that we can expect in 2020?
It's unique. I think if you look at it as a disruptive industry and with new regulation, I think the one thing we're advising a lot of clients is to really manage tightly, because if you're going to see market volatility, then one piece of it is how well are you managing your business, because that's the one thing you can control. So I guess some advice I can give there is a lot of traditional businesses do an executive meeting roughly in an agile disruptive space. I mean, one practical piece of advice is to do a weekly agile meeting, keep an eye on what's going on, and as part of that agenda, have your experts kind of at least once a month checking in on what's going on, whether that be on the legal end of things that has to do with changes in global markets. I think you were tail ending on the IP discussion about whether there'll be increased use of IP. I think that, yes, there's intellectual property available, different things you can do, whether it's patents, trademarks, plant breeder rights, but how does that suit your business strategy? So in terms of tying an IP strategy to business strategy, how does it tie into potentially your acquisition strategy, your marketing strategy, your go international strategy, and or on a domestic front, how does it tie in? And you tie that back to, again, managing tightly with the weekly agile meeting. I think you got to be open to that changes may come around the bend that you won't expect, and you have to not get emotionally tied to any of your decisions or your tactics, and be willing to change on the fly. I looked at online gambling space back in the day, online pornography, in terms of nutraceuticals, a lot of controversial industries, there's lots of change. And so there's a logic to things happening, and there's also, depending on political currents, things that happen. I think there can be things that happen very quickly that will change on the dime what you want to do. So I don't know if that's helpful or not, but it's I think it's important.
Yeah. No. Sorry. So now, James, just because we have the opportunity to hear straight from the horse's mouth with an LP on the line, how much of your day is spent thinking about maybe the Canadian market versus certain international markets, and maybe to use that as sort of how more of like a holistic trend that we're seeing more from Canadian LPs with respect to market interest?
Yeah, I mean, we're definitely interested in the Canadian marketplace, and that's where our revenues come from on day in, day out basis today. Having said that, that's not where our revenues are going to come from tomorrow. And we know that the markets are evolving quickly. Going back to Sanjay's comments, we do try to be that agile organization, from being nimble, pivoting as necessary, fail forward, if you will, really treating our organization in a startup type of mode or an entrepreneurial mode as much as possible, and not being emotionally connected to those decisions like you had said. And that's the same approach that we have to take to what we're doing in Canada versus the international marketplaces. The Canadian marketplace is really important for us. Absolutely. Hands down, it's where our revenues come from today. Is it where our revenues are going to come from tomorrow? No. To most of my day, probably 60%, 70% of my day, even more, is spent thinking about international markets, and in particular right now, the U.S. We see the U.S. as being a great entry point for us with the change in the Farm Bill and where CBD is headed towards. There's a great position that the Canadian LPs can take in the U.S. marketplace, and it's important for us to be there early on. So we spend a lot of time worrying about that, a lot of time focused in on what is our U.S. entry strategy. But at the same time, our secondary marketplace is EU, our third marketplace is going to be Latin America, but in that order, right? U.S., EU, Latin America. Each one of them has its own reason for being there, but the U.S., just looking at it from a point of view of its proximity, it's similarity from a point of view of the economy that we operate in, and the approach to product. Absolutely, it makes perfect sense. That's where we're spending a lot of time.
Interesting. So if that was then the view of from a Canadian licensed producer, maybe Brady, Sanjay, you can kind of maybe speak a bit more towards the investor viewpoint. And so what are some of the investors that come through your networks that you are seeing? What are they telling you with respect to how they see this 2020 market going? Is it, more interest in the Canadian marketplace, or are they themselves starting to become more curious about specific markets and so forth? And so I'll start with Brady just to kick things off.
Put me on the spot.
Yeah.
Sanjay.
Yeah.
So it's interesting, right? I think the broader investment community is in this phase that we talked about kind of when we kicked off, that we saw the euphoric trade happen. We saw everyone kind of sell on the old buy on rumor, sell on news. Legalization happened, and now we've gone through legalization into 2.0. And so you've got an investment community that's saying what happens next. And when you think about the Canadian investment community, it has a bit of a herd mentality that they look for a trend to be able to follow, and cannabis was able to capture that in a big way. They also need something that's an event that they can trade off of. And so legalization was that event that they were all looking towards. Now, we're 5 years into the first company being listed with us. So they're looking for financial performance from these companies, which is bringing a rationalization of valuation back. And if you start to say, okay, well, how do you recapture the imagination of the broader investment community that's here? You need to be thinking about what are the different events that we can communicate, that we can use to capture that imagination, to be able to create visibility to the future growth of this industry. And events that are coming up is speculation on legalization in different jurisdictions. It's going to be figuring out and proving out efficacy of drugs, of this as a drug, and how it can be used in different ways. And that ties back to your IP question. But companies do need to be focused on some value creating milestones and being able to communicate those going forward. And the companies that can effectively do that are going to capture the bulk of the investor wallet.
Sanjay, what's your thoughts?
I don't know, with going international, one thing we've seen is that there's always a look to potentially go international if you can reduce your cost to grow, so your cost per gram. And so there's some moves to kind of go into other markets. Again, though, it comes with a mix of opportunity and risk in terms of new regimes. You don't know what your resourcing people, your talent is going to be for affecting the strategy of the regime. Also, if you're in businesses where you start going international, there's also how do you control that, different time zones and that, your span of control and maintaining what I think James referred to as being agile strategy can go. I was in a business past lives and industries where we had in Australia, very difficult to kind of stay connected to our core business, which was located in North America, just because of the geographies. So I also think from an investors, I rely on what Brady spoke on investors, but I think investors are generally also conservative. So if they see something to jump on, there could be interest, but at the same time too, for an investor, I'm sure whatever you put in front of them, it's got to make one, financial sense, two, strategic sense. So, and if you screw it up as well, then you're going to burn yourself with that investor market as well. So you want to get it right.
Thank you, Sanjay. So I just got a message from Jess. I believe is it Jess? Are you going to hop on for 2 minutes and we're going to introduce?
Sure.
I appreciate the question. I'm going to keep it brief though too, just because I think there's some topics that we wanted to cover here. I guess Grant Thornton does play in a lot of different countries, and we also have the benefit that each of the Grant Thornton organizations runs almost independently. So they understand the local, but there's a network that's international. In terms of services that we offer, it's a mix of consulting, traditional accounting, and tax, and there's also ancillary services that might be specific to different regions. Our approach is to build an industry group, at least here in Canada, and also leverage our international relationships in Grant Thornton to build a knowledge that's going on. We use a conservative approach, so we're looking at it as a new industry. We're not going to give advice that's reckless, and maybe we are too much on the conservative end of it. But in terms of what we've seen in terms of disruption and other things that have cyclically played out, new areas, taking a conservative, balanced approach, we think that our position is to be that sober second opinion advisor, coming from maybe the more pessimistic side of it. But if you want a fine line for what I would call good business acumen, I think it is a line that runs between managing risk and opportunity. Entrepreneurs and people on the opportunity end tend to lean more to the opportunity side. So I guess for us to be very conservative, we'd like to more bring the balance over to the risk end to maybe help that entrepreneur get a balance. Brady, did you want to?
Yeah, sure. So I'll try to keep this equally brief. In Canada, there are a couple of different options out there for companies to be looking at. One of them in the CSE has made a name for themselves in the cannabis space. Today, US cannabis specifically counts for over 80% of their business, arguably over 95% if you factor in the Canadian companies that are trying to make efforts into the US. If it wasn't for the fact that TMX Group did not allow companies who are actively trying to violate the US Controlled Substances Act, we don't allow them to trade on our market because you're breaking US federal law. And if it wasn't for that exchange likely wouldn't exist. NEO, on the other hand, I think they have all of 4 listed companies on the market today. And so if you're a cannabis company that's seeking to capture investor appetite, be able to communicate that you're obeying the regulations in dynamic regulatory environments, you're trying to figure out how to communicate and build trust with your investor group, then you need to be looking at the TSX and the TSX Venture Exchange, because over 40% of our daily trading activity comes from outside of Canada. 25% of the member firms that we have who facilitate financing and trading and support for the issuers who are listed with us are headquartered outside of Canada. And the further you get from Canada itself, the more you'll find that focus on where are you listed matters. It's what gives investors confidence in whether they want to invest into you or one of the other peer group that's out there and listed. And so I think when you talk to other cannabis CEOs, you'll find that those who are now actively marketing in Europe find that either a venture or a TSX listing opens doors for them that listings on other markets don't. And it's because we have, a long-standing track record of building credibility, not just in one space, but across the entire spectrum of mining, technology, cannabis, ensuring transparency and doing background checks on the management teams to make sure that we've got quality actors building businesses with us.
Brady, Sanjay, James, we have to wrap it there. I want to thank you all for joining us. This was great. Thanks so much.
Cheers.
Hey there, this is Jeff Howard.
Hi, Jeff. Hi, David. Hi, Patrick.
Hey guys, it's Patrick Barry here.
So we didn't get a chance to do introductions just for the sake of time and just because we want to stay on schedule. 30 seconds, starting with David. Who are you? What do you do?
Sure. So my name is David Friedman. I'm with Panther Capital. We're a cannabis-only venture capital fund. Invested in about 25 deals in the last 5 years. And I also act as CEO of certain portfolio companies from time to time. Right now, I'm currently CEO of Vivigrow, which is an infrastructure play in the cannabis space, and a portfolio company of Panther Capital.
Jeff?
Okay, yeah, so Jeff Howard here. Thanks for everybody who's joined. So I am a managing partner at Salveo Capital. Salveo Capital is a traditional venture capital fund. We're located in Chicago. And we founded Salveo Capital in 2016. And so the fund is exclusively dedicated to making cannabis investments. And so we've been making investments out of that fund from 2016 up to present day. We have a portfolio of exactly 19 companies, and it ranges the gamut from ancillary non-plant touching to plant touching brands to a couple of MSOs and SSOs. So we have a pretty good cross section of companies in our portfolio.
Thanks, Jeff. Patrick, do you wanna do yours?
Sure, thank you. My name is Patrick Berry. I'm the Chief Investment Officer of Granite Hall Partners. We are an alternative investment firm that pivoted into cannabis from private credit and private equity and other things that we were busy with in 2016. And since 2016, we have backed 5 cannabis portfolio companies to the tune of about $120 million and in total. And we're just about to do our first hemp transaction. So that's us. We're headquartered in Chicago.
Great. All right, David, Jeff, Patrick, thank you. So just to kick things off, we're going to be talking about, specifically today, investment opportunities in the U.S. East Coast and Midwest. There's a lot happening. Seems like every month there's a new market coming online. Maybe we'll start with David. What's the status of retail investment opportunities right now in a lot of these, whether it's existing markets or new markets or markets we're anticipating? What's your 2 cents on the opportunities?
Yeah, so just to clarify, when you say retail investments, are you talking about people that are retail investors that can get in on the retail side? Or are you talking about?
Sorry, on the retail investment side.
Got it.
Yeah.
So look, I mean, just conventional wisdom would say the sector's been hammered over the last 60, 90 days, arguably over the entirety of 2019. It's still a speculative industry, but certainly, I'm not really a stock guy, but the notion of buy low and sell high, you certainly want to buy in at a time when the industry has been hammered like the cannabis industry has. I don't know if we've hit bottom, but I don't think that this is where the industry is going to stay as a whole long term. That said, it's hard to pick which players are going to eventually be standing when all the dust settles. But all in all, I would say that this is a good opportunity for the retail sector if you do your homework and you understand what people's balance sheets look like and who's got cash and staying power. Long term, I do think that there's significant upside from where the markets sit right now.
And then, so David, I'm just reviewing this question here, and perhaps maybe then, rather than from a retail investment side, what would be your view from a fund investment side on what the opportunities are? And then maybe that's more direct and personal to what you do.
It is, but I would say kind of the same thing, right? I mean, we're moving pretty slow with respect to any exits right now. We've got a couple that people are talking to us about that we've pumped the brakes on because it's just not a good time to sell into the market. We're active. Right now, valuations are down. There's some contrition around issuers that are, looking to raise capital, or who I would say we're even looking at some distressed situations. That's something that I have a background in over the last 25 years, is investing in distressed assets from an equity perspective. So we're pretty active right now, given where the sector is at from, the same perspective as a retail investor, as a fund. We're looking harder at deals now than we have probably at any time in the last year and a half.
Jeff, if I was to flip that over to you, do you agree with David? Do you have similarity in viewpoints, or, what's your take on opportunities currently in East Coast and Midwest?
So I'll just say, so broadly speaking, I don't think the lows are in at the moment. I think it's close, just based on the pain that the market has inflicted over the last 5-6 months. And I do think from a retail perspective, Canadian retail, got caught and didn't fare so well. But back to the U.S. So I do think that there are a tremendous amount of good opportunities in the U.S. specifically. I think the Canadian trade has been done for a while, and there's been obviously a massive pullback in capital into the space as a result of the macro background. But the trade is clearly focused on U.S. and U.S. names for the time being. And then you get, more specifically, we're always more focused on private companies as opposed to public companies. I think private, companies have been affected by this downturn, but clearly not as much as the public market has. And so there's some protection there. And then you get to the East Coast, Midwest and East Coast specifically. I still think there's some great opportunities, with the right valuation, and valuations are coming down in the private market even. But I think there's good opportunities, private MSOs, or even for some of these, larger states that are about to come online, SSOs, single state operators. And so we like the Illinois market. We think that's going to be great. We love Michigan. Massachusetts, we have some investments there. That's been a massive disappointment to date, but expect, I think, at some point to be a good one. And then Florida, I think there's a tremendous amount of opportunity from an operator perspective, not only in Florida, but I also think that from a product brand perspective, it's going to, if someone cracked the Florida brand equation, I think there's potential there as well, because it's just such a big market.
Thank you, Jeff. Patrick, Jeff liked Illinois, Michigan. You saw Illinois kind of come online firsthand. As we're starting to experience Michigan activate, is there differences that you're seeing in your viewpoint from where opportunity might lie, or, are we seeing, for you, is it sort of a similar story that you saw in Illinois, and we can expect the same for Michigan?
Sure. The biggest difference between the two markets is in my opinion, is the rate at which they are evolving. Michigan passed its adult use measure by a ballot initiative. What happens then is that when the ballot initiative is passed, the next thing that needs to happen is that the regulators need to come together and write regulations. A law has to be written to fit that ballot initiative, and then regulations have to be written to fit that law. As a result, although Michigan passed adult use in 2018, I believe November 1st is going to be the first date for Michigan adult use businesses to submit applications. In contrast, Illinois passed adult use as a result of a legislative action with a law and a set of regulations already in place. And also, like the Nevada move, it was sort of a ready or not, on January 1st, we're going to be adult use. So whatever you can get stood up by that date, that's what will get stood up. And so as a result, on January 1st here in Illinois, you're going to have probably a low number, because it will just be the existing medical licensees that can also sell to adult use customers. Michigan is taking longer, in our view, because of that regulatory process that the state undertook to get to where it is.
Yeah, and I'll just add to that real quick. Sorry, I think Patrick brings up some great points about the differences in the two markets. I think both markets would be big, but Michigan, most people don't know, is the second largest medical market outside of California. So it's a massive market. But what Michigan also has is a fairly deep-rooted black market, historical black market. And so, the success of the rec program is really going to rely on how much they clamp down on the black market. I think Michigan's black market, I don't have stats in front of me, but I think Michigan's black market is much larger than Illinois'. And I think Illinois is, from a regulatory perspective, is being extremely conservative as far as the program. So I think if Michigan can control the black market, it's going to be a big market.
Interesting. David, do you have any thoughts on that?
Yeah, I mean, I hate to say this, being from Chicago. It sounds like we have an all Chicago panel, but it certainly seems to me like Chicago has their act together, or Illinois has their act together with respect to getting this rollout done in an organized and professional manner. It may not be to everybody's liking because the incumbents have a significant advantage, but if you compare that to Michigan, which is just experienced delay after delay after delay, and states like Massachusetts, as Jeffrey alluded to before, they've been fairly organized. They got the resolution approved very quickly, and they put a plan in place that I think is achievable. I think the markets will open up to non-incumbents through the next rounds of licensing. I would rather be playing in the Illinois market than the Michigan market for those reasons, as well as the ones that Jeff kind of suggested, and Patrick as well. I just think by sheer volume and surprisingly by the level of organization that Illinois seems to have. Now that all can change in a blink of an eye with Illinois and politics being what it is here, but so far it seems to be so good.
Guys, we've only scratched the surface. I'm just getting word that our next keynote is running on a tight schedule. So unfortunately, I have to wrap this up. I have so many more questions. So, and we have a couple of questions that have come in. For any of future questions, is it okay if I connect them personally to you? Are you okay with that?
Oh, sure.
Definitely.
Is that with some of the companies? All right, perfect. Otherwise, David, Jeff, Patrick, thank you so much for your time.
Thanks, guys.
Thanks.
Good day.
Bye-bye.
Bye now. Up next, we have, so unfortunately on that one, we just got a little taste of East Coast and the Midwest, but fortunately enough, now we're going to move on to the West Coast, the state of the cannabis industry, and to present us with that information, we have Tom Zuber, founder and owner of Zuber Lawler, one of the leading lawyers in the U.S., to help educate us. So Tom, I will pass it over to you.
Great. Thank you very much, Graham. I appreciate it. So Tom Zuber, managing partner of Zuber Lawler. I'm speaking to you from Los Angeles, and I'm grateful to the Cannabis Society for putting this virtual conference together. I think it's a big step forward in terms of making the cannabis world smaller. I am the managing partner of the firm, and we have offices in addition to LA, Silicon Valley, Chicago, and New York. We represent a long list of Fortune companies in technology, Silicon Valley, and pharmaceuticals, in restaurant chains and banks, and so on and so forth. We do this work around the world in languages covering 90% of the world's population. And what makes us unique as a law firm is that we've also been in cannabis for over 12 years, maybe 13 now. So as far as the law firms that do the M&A, the IPOs, the high stakes litigation, the intellectual property, FDA work, and international work, that makes us precisely unique. There's no law firm like us that's been here for even over a few years, much less over 12. So that gives us, I think, a pretty unique perspective on the cannabis industry. Our law firm is also made up of a bunch of scientists and engineers. So when it comes to the technology of cannabis, whether it's in an M&A context, an IPO context, in a litigation context, or in a global portfolio building context, we have quite a roster and quite a capacity for that. So as examples, we have in our New York office a PhD pharmacologist from Yale who's a patent litigator. We have here in our LA office a PhD botanist who's a patent attorney who obtained the second ever issued U.S. plant patent for a cannabis strain. We also have a patent agent who's got a PhD in molecular genetics and cell biology from University of Chicago. That was after MIT. We have a literal rocket scientist between MIT and honors at Harvard Law. He was designing GPS systems for satellites and missiles, and he's also done a lot of biomedical device work. So that makes him, for instance, well suited to analyze technologies relating to delivery devices and so on and so forth. As far as the state of cannabis, to start with the big picture here, it's exciting. It's an exciting period for the cannabis industry worldwide. It's also a challenging time. Obviously, there's a notion of a bubble in Canada. I think that was expected by many of us, but obviously that's tightened up the markets to some degree. On the other hand, the M&A activity continues, and our law firm does a lot of it. Zuber Lawler does a lot of that, certainly here in the United States, but also increasingly M&A across borders. So we have large companies from other nations that are looking to grow operations here in the U.S. and vice versa. So that makes things very interesting. Also, there is an enhanced focus on what things are going to look like post-prohibition here in the United States. So of course, at the present time, $90 out of every 100 are spent here in the United States. So that makes this the largest market in the world by far. $50 out of every 100 spent in the cannabis world are spent here in California, in fact. So there's an awful lot of focus on when prohibition will end. And there are rumors that it may end next year. In fact, I will go ahead and make a prediction. I believe that Trump is likely to deschedule cannabis prior to the next election. So obviously that's speculation by definition, but it's grounded speculation in the sense that I believe that Trump is going to decide that, to share my logic, that he wouldn't lose any base voters if he removes cannabis from Schedule 1 of the Controlled Substances Act, which prohibits it at the federal level here in the United States. And second, have decided that he won't lose any base voters. As a function of doing that, he's already made a conclusion that he will obtain a large amount of a material amount of additional voters that he wouldn't otherwise gain if he does in fact remove cannabis from Schedule 1. So I think based on that analysis, Trump has already decided to take that bag of votes off the table and put it in his pocket. So if I'm right, that would mean we can expect Trump to deschedule cannabis sometimes between spring and more likely probably I think the summer of next year to get that bump prior to the election, which takes place in November of next year, the presidential election here in the United States. Whether or not Trump does it or someone else does it, I think that we all here in the United States are increasingly looking at the end of prohibition. And when that happens, we think that not only will it affect commerce here on the West Coast of the United States and throughout the United States, but frankly throughout the world. More and more countries are going to look to export technology and various components of the cannabis revenue streams to the United States, and the United States is increasingly going to look outward. So it's a very exciting time. So on that topic, there are a few things perhaps that I can focus on because there are so many things to focus on. But one of the things I'd like to focus on is intellectual property. As we continue to watch the cannabis industry evolve to become corporate, so to speak, and to move away from illegal markets, it's very exciting. Increasingly, it seems to me, and I think many of us, that the cannabis world is going to be focused on intellectual property, and to take a lesson from just about every industry that is not cannabis. If you remove the intellectual property from the books of the greatest, most iconic companies of the world outside of cannabis, oftentimes 50, 60, 90% of the value of that company disappears. I do believe that the cannabis industry is a technology industry as much as the pharmaceutical industry is the technology industry. There is so much technology inside of this plant, and I believe that we are seeing the tip of the iceberg. As an example, here in the United States, the very first patent litigation relating to CBD was filed in the state of Colorado. For those of you who are outside the United States, it was filed by a company called United Cannabis Corp against Pure Hemp Alternative. As the first CBD litigation ever filed in the United States, there are quite a number of folks focused on it. This patent essentially speaks to any product that contains 95% or more CBD as compared to total cannabinoid content. So I'll say that again, this patent ostensibly gives rights to United Cannabis Corp to exclude others from introducing into the marketplace, making, importing, using, selling any product in which the total cannabinoid content is 95% or greater. So of course, most CBD isolates on the market today. So it is a test drive litigation, but if this goes well for United Cannabis Corp, then it seems likely they're going to take this car out onto the road and start knocking other cars off of it, either by obtaining license fees or additional litigation. So to punctuate the point again, this is a technology industry, and it's going to look like a technology industry in terms of the valuation of companies being made increasingly up of intellectual property, but also in terms of the litigation that's going to descend on the landscape. On that note, what we can expect to see, I think, on a technology front, not just here in the United States, but throughout the world, is increasingly a focus on the technology that lies within the plant, not so much in terms of isolates, but in terms of, for instance, as one of many, many examples, the interaction between different cannabinoids within the plant and other aspects within the plant, and how those interactions affect the degree to which any particular cannabinoid, CBD or other, is taken up by, for instance, a cannabinoid receptor within the human body, like the CB2 receptor, which CBD tends to favor as opposed to other cannabinoids like THC, which tends to hit the CB1 receptor located in the head. On that note, we're going to find, I believe, more technology that figures out, okay, how do these interactions affect the degree to which the human physiology is affected by any particular aspect of the plant. Delivery devices, dosing, those sorts of things, as cannabis is increasingly looked at as a replacement for drugs, or actually as pharmaceutical grade drug itself, we're going to find an increasing focus on the degree to which those administrations of the cannabinoid product are precision. And that's going to happen through delivery devices and many, many other aspects of this plant. So on that note, again, technology, I think, is going to become increasingly a focus. And here in the United States, that is happening. And our law firm does a lot of work on that front. Another area that I think folks are going to focus on is branding. So here in the United States and in California, which is a pretty well-developed market, if I have a can of Diet Coke here in California, I'll have the same experience as if I open a can of Diet Coke in South Africa or in Zimbabwe or in China or in Colombia. But if I have a joint that I buy underneath a brand in a major retail shop here in Los Angeles, and then 6 months later I go and grab a joint under that same brand from that same retail shop, I could have a very different experience, and that's unacceptable in any industry, and that will soon be unacceptable in cannabis. So it seems to me, and I think increasingly to others, that the companies that are going to dominate post-prohibition here in the United States and globally are going to be the ones that best achieve a consistency of user experience across state and then sovereign borders, just like any other industry. That degree to which that's true is amplified by an integer factor, probably a large integer factor, to the extent that we're talking about cannabis products that replace drugs like opioids, for instance, where precision is everything. Another area of focus here in the United States is the upcoming FDA interaction with CBD and ultimately THC and other cannabinoid contents of the cannabis plant. Currently, here in the United States, the FDA has there's something called a preclusion, and this preclusion, an IND preclusion, which essentially says that once something like CBD, for instance, is approved as a drug by the Food and Drug Administration here in the United States, it by definition cannot be a supplement or a food. So that's the status of things up until and including today. So given that CBD was already approved by the Food and Drug Administration, by the FDA, in the form of Epidiolex, the FDA approval obtained by GW Pharmaceuticals. Currently, this preclusion prevents the FDA from issuing an approval for a supplement or a food, right? And of course, the problem with that is that to get here at the FDA level, and forgive me, I'll take about 30 seconds to give a regulatory lesson, and pardon me, but once the drug path for FDA approval is typically, it's a 10-year plus process. It's $1 billion plus process. And so the notion of having all CBD products meet that threshold is, it's a bit absurd, right? And the CBD product is already out of the toothpaste, is out of the tube. So right now, currently, if somebody were to approach the FDA and said, hey, I don't want a drug, but I do want to put something on the shelves of my local supplement store, and can I have FDA approval for that? Or I want to put it into a food. I'd like to put it into brownies and to offer that to folks. Currently, the FDA's answer is no. There is a notion that the FDA may make an exception. We personally believe that I personally believe that that's likely, as do my colleagues. If that happens, then what's going to happen is the FDA is going to begin receiving what's called supplement, NDI approval applications, new dietary ingredient approval applications, and also underneath that, GRAS applications, generally recognized as safe applications in relation to CBD and foods. Those processes, as opposed to 10 years, could take a year, about a year. And the fees are much lower, like in the low six figures type of lower as compared to the drug process. If that happens, then then the FDA, it follows, will begin regulating this content. So what this gets down to is the FDA is everything right now. So we're going to see, as we continue to proceed toward the end of prohibition, as the FDA gets its arms around this subject matter, we believe that we're going to see some dramatic focus on the FDA landscape, the regulatory landscape, and this is going to result in more letters like the one that went out to Curaleaf saying, hey, take this product down off the shelves. Curaleaf, for those of you who don't know, they were ordered by the FDA to pull down their product, and it was low-hanging fruit in the sense that there were claims there that the FDA didn't like about the efficacy of relevant products. But that was low-hanging fruit, and it was a shot across the bow. The FDA was saying, hey, this is our business, and we are going to regulate. But I believe that that's just the beginning of things. The final point that I want to make here in the United States, particularly here on the West Coast in California, we're increasingly looking at the international marketplace and how much that's going to affect, well, the lives of all of us in the cannabis industry, wherever in the world we sit. But here in California, what we're looking at, for instance, is, okay, well, when these large fortune companies begin to enter the cannabis space and they'd like to purchase CBD or hemp to put into their product, which is already, let's say, a multi-billion-dollar product line, are they going to purchase that CBD, that hemp? Are they going to purchase that from the state of California? Or are they going to purchase it from Colombia or Thailand or another part of the world? And so that's a question that needs to be answered, but increasingly we're beginning to look at those things. And so then a question becomes, okay, how do I keep my operations here in California relevant? Am I speaking to a premium branding opportunity where people will pay extra for that premium brand that comes from the state of California, which has according to some, a cachet associated with it in terms of culture and history and expertise relating to navigating the context of the cannabis plant? Or am I going to be looking at acquiring assets in these other parts of the world pursuant to bringing in lower production cost product into the United States, starting with hemp today and then THC tomorrow post-prohibition? And that's something that's an exciting conversation. It's a challenging conversation. And I think that the opportunity is in the challenge itself, like can be said about the cannabis industry as a whole. So we're looking at helping our clients perceive this opportunity to get out in front and to start to navigate these challenges of cannabis and post-prohibition cannabis even today before prohibition is ended here in the United States. So I do believe that's about my time, so I'll stop. But I will say that I am delighted to have this conversation. This is an awfully small world, and I think the Cannabis Society has made it even smaller by this virtual conference. So I'm absolutely delighted to be a part of it. Thank you. Yeah. Sure. Well, I'll give a shout out to our friends at Miller Thompson. Miller Thompson is one of the elite firms of the world, and they're a go-to collaborator for us to navigate higher stakes issues between the United States and Canada. So we're developing a friendship with those guys, Alex and Lori and Sarah. I don't know if they're on the virtual conference as I speak, but that's just an example It is a small world here, and it makes a lot of sense to make friends in other countries. Our model depends on it, Bill, as you know. So our law firm does do indeed. We work in languages covering 90%, literally 90% of the world's population: Russian, Chinese, Korean, Japanese, Spanish, Portuguese, the Farsi and Hebrew. I'm still struggling with English myself, but my colleagues are mostly multilingual. The thing about our law firm that some folks may perceive as odd is that we have no intentions of ever owning a foreign office. And in fact, we believe that the premium model, the model of the future, will be the model that we've selected, as opposed to having three corporate attorneys in an office in Moscow. We've built relationships with various firms in Moscow, and one we go to for premium M&A work, one we go to for regulatory work and litigation, and one we go to for intellectual property work. And these are the best attorneys. These are top attorneys in Russia. The difference is, one, we're picking the best attorney for the job, so we believe we achieve a better result. And also, it's mathematically demonstrable that this model is more efficient. We're not enforcing U.S. profitability standards on our colleagues in Russia. So increasingly, our clients, our very large publicly traded clients, are saying, we agree, that's a better model. We get better results, and it's a more efficient process. So our business plan going forward depends on us making friends with folks like the fabulous attorneys at Miller. And we could say that about, friends in I'll give a shout out to Memory Crystal out in London. I don't know if they're on the call, but we've had developed quite a warm relationship with them, and Herzog Fox out in Israel, and others throughout the world here. And it is a small world in cannabis, and we're delighted to have the friends that we do, so we can help our clients grow internationally.
All right. So we're going to be talking investment opportunities in the West Coast. First and foremost, before we kick things off, just because you guys haven't had a chance to introduce yourselves, starting with Cody, could you please introduce yourselves and what you do?
Sure. I'm Cody Sanchez, and I'm with Entourage Effect Capital, formerly Cresco Capital Partners. Good to see a few familiar faces here. How's it going, Matt?
Hey, Cody.
So we are a private equity and venture capital style fund in the cannabis space. We have about $140 million invested in the space in 43 companies, and I'm a partner at the company.
Matthew?
Yeah, great to see you, Cody. We're very similar at Arcadian. I'm the founder and CEO of an asset management firm called Arcadian. We hover somewhere between venture capital and private equity, but essentially looking for growth round opportunities focused on cannabis. And similar to Cody, we're about 32 companies, I think, 32 companies today. And excited to be on the call, share some more.
Perfect. All right, so Tom just gave us a pretty good overview of the state of the U.S. marketplace, and more specifically California as well. I know myself, when I travel to various international markets, California is often referred to as this anomaly, almost like a wild, wild west that's contained onto itself. So from maybe an investor standpoint, when you're looking at the California market, and specifically investment opportunities in the California market, how much weight are you giving these companies that, for example, how much weight are you giving to these companies, whether they're thinking international expansion or whether you think that the local market as well as the national marketplace is big enough and attractive enough to place your bet? So I'll send it over to Cody first if you want to give your 2 cents.
So to make sure I understand the question, it's how much are we placing the bet on the California consumer as opposed to the national consumer?
Sorry, no. So when you're investing into, let's say, a Californian company, which kind of plays in a different ball game today with respect to recreation or even medical, if we want to talk about medical, how much weight are you given to that company for when they're presenting their 5-year projections, that that those projections are contained within the U.S. or local markets? Or are you really interested in companies that are thinking global and international and breaking into Europe and so forth?
Yeah, I mean, it's an entirely different ballgame right now. So I'm not even sure the question is, can this company go global? I think the question is, does this company have 12 to 24 months of capital, and is it able to weather this liquidity crunch that we're having today? So, at this point, we have such a sizable market in California and the US that I'm probably a little bit biased against companies that are, doing, let's say, less than multiple hundreds of millions of dollars and then trying to internationalize. I think that's too aggressive, and in any other industry, we would not be seeing that. And cannabis is unique in that you could have a company that's doing $10 or $20 million and wanting to expand to other countries. I think that model has been proven of late to be a little bit risky, because you won't have enough capital if you're a public company to go to execute on those plans. So for us, it's definitely, can they capitalize on the Canadian or on the California market? Then could they expand very strategically in follow-on states with similar mandates or geographies? And finally, could they do something across the US entirely and then maybe internationalize?
Interesting. Matt, if I could throw it over to you, do you feel the same sentiment as Cody, or do you have a different perspective on that?
I do feel the same sentiment. I think that, in a lot of ways, the cannabis industry is really, yes, it's experiencing accelerated growth, but because of the fact that a lot of these companies went to the Canadian public markets, by default, I think you were in a system whereby you're looking at a market with less than 40 million people and not a lot of tourism. And so the companies that achieved scale there that weren't able to address the US market had to go international in order to sell a growth story. So you saw in the early days, the larger MSOs were going to Jamaica or this Latin American country, or saying they got something going on in Europe somewhere. Those kinds of things were what they needed to sell to the market to say, hey, we're going to have a growth story. In the US, that's not the case. You can go state by state and still have a great growth story, and you don't have to get ahead of yourself and try to take over the world today. I think what Cody said is exactly what every company in this space is experiencing, especially the public ones that have to answer these questions every day, is what is your revenue today? What are you doing today? Yes, we all believe cannabis and hemp are going to continue to have this hockey stick-like growth curve for a long time, but that doesn't necessarily mean that hundreds and thousands of companies get to have that entire market share. So we have to make sure they project a realistic market share of that potential growth. And then what is that potential growth? You can't just sell the fact that there's a world of opportunity. You have to actually indicate what you have today and what the reality is of your market share expansion being the case tomorrow and in 2 months and in 6 months. As Cody said, the next 6 to 12 months are going to be a time where you're going to have a lot of this become very clear, because there is no more equity in those markets up there. You're going to have a lot of debt and credit, and that's going to force people to hit marks on a monthly basis or go under. So I think it'll change pretty quickly. But the last comment on that one is market share is a very important topic for us, and I think on a lot of the investors, because if you're looking at a potential exit, your exit partners are going to look at that as well, whether it be a Fortune 500 company or a public market. They want to know, what is the total addressable market share today, and what piece of that are you? And if you want to have a great answer, if you want to have a large piece of that market share, whether you're on the supply chain or you're a grower, you're a seller, you're a manufacturer, you're a software company, you've got to be able to clearly indicate what is the world's market potential today, what piece of that are you? And if you're going to be a big piece of that, where does all of the volume come? Well, California represents, I don't know, Cody, 30-40% of the entire world's legal transaction. And so if you exist somewhere in the supply chain of cannabis and you want to be at scale, you could have 50% of the Canadian market. If you had 90% of the California market, you would have like 2 or 3 times the share of the world's total addressable market in most cases. So you have to go where there's real revenue, real transactions, and real market from a legal perspective today.
That almost sounds like a monopoly. So as I'm hearing your perspectives on this, it's interesting, because it's almost like I'm hearing a conservative approach to investing, in that what you're doing is you're putting revenues first, whereas when, in my own bias, when I think about the California investment market, there's always the terminology of die fast, or, like invest big promises, big raises, which kind of we've seen in Canada with these LPs and these, and to your point, Matt, where they're trying to show this growth opportunity through various assets that they own around the world. Whereas right now, these California companies are, they actually have real revenue, and some have more revenue than these publicly traded companies. Do you think in the long run this is going to make these companies stronger, or do you think that they are still, though, limited by the state regulations, because you don't have a harmonized, national regulation? They're forever going to be contained. And yeah, sorry. Anyways, maybe Cody, if you have any thoughts on that, I'll pass that to you.
Well, I think that California is an interesting market from an acquisition standpoint, because if you think about what we are trying to grow here, it's really not dissimilar to, let's say, the alcohol or wine industry. So California, Portland, California, Oregon, Washington, I imagine once the States Act goes through, which is sort of our bet eventuality, you are going to see that being one of the main areas of cultivation within the US. If we have barriers to international export, which I imagine we will for some point of the future. So I imagine cultivation, continues to be important there. And, we've seen that California is really a center for innovation across startup industry. So we're not just talking about cannabis overall, but we're talking about the more innovative aspects of it. A lot of the biosynthesis companies are based out of San Diego. That could be a 3 standard deviation event to the industry overall. You see a lot of the biotech or genomics companies based out of San Diego as well. In San Francisco, you see a plethora of companies in the industry are based out of there, simultaneous with a lot of the big MSOs. So I think California continues to be important. But that being said, we made an investment in a company on the East Coast called Holistic. It's the largest private MSO. And they're doing really interesting things navigating the more politically, I would say, gated communities on the East Coast, because it is much more regulated on the East Coast, obviously. You have much more gating mechanisms than you do in states like Denver, even Nevada, California, Washington, Oregon. And that gives this company, I think, a little bit more of a runway, because they have some barriers to entry from competitors for the foreseeable future. So I don't know, I don't want to get too excited about California, because as we know, California loves regulation and taxation. And every other business besides cannabis, people are fleeing the country. You almost have a net deficit like New York. And so I am worried about oversaturating the Californian market. We do diversify out of California. That said, Gavin Newsom just passed 8 laws that are actually pretty positive for the industry overall, including, a little bit of 280E lessening on taxation, which is huge for companies they're in. So they've surprised me. Not very often does California have an incentive to decrease taxation or decrease regulation, and they actually did.
Interesting. Matt, when you're thinking about diversifying your portfolio, can that be done within the West Coast alone, or are you also looking in other markets such as the East Coast and so forth?
Good question. I think one thing we need to do in this conversation is really to differentiate the assets across the supply chain of cannabis, because these answers are going to be different if you're talking about retail cultivation manufacturing, if you're talking about a B2B type company, a consumer facing company. They're all in a little bit different phase right now. So, we probably should, and then cannabis and hemp are completely different, right? In terms of the business. So, a lot of these are very macro level generic answers that Cody and I will provide, but in terms of compartmentalizing the industry, we can go there if we need to. But in general, I would say a lot of our companies don't have the same constraint that a plant touching company does. If you're a software company, you're not limited by a state restriction. You're only limited by the resources you have to grow your business. And so if you're able to, raise some capital in a round to grow your operations, you basically have some salespeople, but you don't have to get a new license somewhere. You don't have to try to figure out how to transfer your IP to a new jurisdiction. You're just offering a technology service. So a lot of our companies have operations and clients in every state that there's cannabis activity, and they have for many years. So we actually don't look at California or New York in terms of just being the only market a company we invest in can address. We expect them, if they're a B2B company, to already be thinking about that.
Actually, Matt, so I do have a follow-up question for you. This comes from the audience, and it says, Matt, you have now had multiple cannabis equity funds. I believe you've just closed a significant one. You've also launched a debt fund. What was the thinking here? Is the demand for debt increasing, and why?
I think it's one of the most attractive opportunities in cannabis today, and that's because the Canadian markets have allowed these assets to be extremely overvalued. And it reminds me of 2008 real estate versus 2000 technology, for example, because of the strong asset base that these businesses have. Said another way, if you were going to form a real estate strategy in 2008, you're probably not going to do that with equity. You're probably not going to be a developer. You know, the best strategy you could have going into a correction with an industry with real assets is to do so with debt, hard money, credit, some type of collateralized and secured, strategy. In cannabis right now, you're looking at assets that are agriculture-based, manufacturing-based, brick and mortar retail that have, real value. What are their licenses valued at? What is the land, the equipment, the IP, real assets, not just a technology company. So when you look at those types of businesses, what do they trade for on any market in the world? Well, you're going to find they trade at somewhere between a 2 and 7 multiple, not 30 to 200 for an agriculture business, and not future revenues. Like, you don't get to say in emerging industry, you're trading at year-end 2020 revenues for an agriculture business. Like, it's shocker that's not going to work, especially when you're talking 50 to 100 times. So what is happening now is you're saying, okay, if you think you're a $2, $3, $4 billion market cap company, we're not going to tell you you're not. But there's a strategy that says, okay, well, what is your real assets? Okay, do you have 200, 300, 400 million assets? Great. Well, then you can provide debt based on that alone. And whether or not the company is worth 4 or 2 or 1 or 800 from a market cap standpoint, you could put senior debt on a business to the point where the limited downside in terms of collateralized.
Interesting. So the opportunity is there. Okay, guys. Unfortunately, I do have to wrap this up. We're moving on to the next panel. I want to thank you, Cody and Matt, for your time. I know it was short, hopefully sweet. Thanks again.
Good to see you, Cody.
Good to see you too, Matt. Thanks, everyone. Bye.
Jamie, can you hear me?
I can. Hi.
Okay, perfect. How are you?
Great. Thanks for having us.
Yeah. All right, so jumping right into it. And actually, maybe just to kick things off, because we haven't had an opportunity to introduce you, starting with Nate. Nate, do you want to just do quick 30, 60 seconds, who you are, what you do?
Yeah, absolutely. Hi, everybody. I'm Nate Yagoda. I'm the Vice President of Strategy of Plus Products. We're a cannabis CPG company based in California, focused on edibles in both the THC and hemp CBD marketplace.
Jamie?
Hi, I'm Jamie Pearson. I am the interim president of Bang Corporation. And Bang is a 10-year-old edibles cannabis company. We're now a house of brands. We started with a flagship chocolate bar 10 years ago, and now we've evolved into over 100 SKUs of CBD, THC, and terpene products. We're distributed in 9 US, soon to be 10 US states. We've got a JV in Canada with Indiva, and we're distributed in our CBD products in 9 European countries.
Great, thank you. So we just heard from a panel that spoke a lot about the investment opportunity, specifically in California, as well as nationally in general. And I just want to get your perspectives on that. Now you're both from the California market, which, when we have our international audience looking to California, and again, just to reiterate, often it just seems like this bit of an anomaly of a market. It's kind of self-contained. What maybe have you experienced coming from California, and what are some lessons that you could, say for these emerging markets based on your experience, and let's call it a mature market? And so Nate, maybe we'll start with you.
Yeah, absolutely. And I think Cody said it well in that, and Matthew mentioned that, California is still while it may, like you said, mature market is almost air quotes, right? It's about a year and a half old adult use market, but it does have this rich history of medical legalization with over 20 years of medical operators, which has led to California being an extremely competitive market. So I think in order to predict the future, people really need to have a crystal clear view of the present and not be surprised for things that have repeated for history. So you look at Colorado, Oregon, Washington, California followed suit, and things like, the reduction in prices in wholesale oil, biomass, and flour, but then also really understand the shifts in consumer trends. So I think it's really, important for people looking from the outside in to really understand, why are people consuming, how are they consuming, how is it impacting other products that they purchase every day, and how does that affect, brands, products, manufacturers, and their strategies. So, I think, as Cody had mentioned, with this sort of capital crunch here, I think the importance is really focusing on winning in the markets that you're in, and focusing on operators that are putting the important KPIs on the board that are typical for CPG companies to be measured on, like market share.
Thank you, Nate. Jamie, do you have any thoughts on that to add?
Yeah, I definitely think that, all of your comments are accurate. I have nothing like to contradict that, but what I would add is, we're seeing things specifically at Bang where over the years, you have to be ready to pivot at a moment's notice. So for example, in Michigan and Oklahoma, we're getting ready to open Oklahoma. Neither of those markets have childproof packaging laws, but we know they're coming. So childproof packaging is quite expensive. So we're ready to pivot into childproof packaging the minute that law comes through, and we know it's going to come. So when you go back and look at some of the other states and what has happened, you have to be ready to make those quick changes, because the brands or the products that are operating under current regulations without having an eye to what's coming in the future, they do lose shelf space, and it is shelf space that's the ultimate commodity in a CPG play. So, we've always viewed cannabis as a CPG play, and Bang's been a CPG company for 10 years. And I also want to comment on what Tom Zuber said, before Cody and her panel were on. Tom constantly talks that, consistency is the order of the day, and that new consumer comment that you made, yes, we have to watch what consumers are doing. They're reacting to the fact that they've got this new freedom. We've got lots of cannabis users in the closet, but as markets come open, people are excited to be able to use cannabis out in the open. And, how are they consuming? We're offering them new options and discrete options, and options that don't make their clothes smell bad, or, microdosing. And it's a brave new world, and we're out there offering these new products to people. We know they make people feel better. That said, consistency, where if you're dealing in flower, it's very, very difficult to be consistent in Michigan with Blue Dream and California with Blue Dream. But when you're making an edible, consistency is actually quite easy. And, I know Plus does a great job. I'm a fan of your products. Bang's been a consistent product for 10 years. And that's why I feel like, especially in the wake of the vape crisis, I expect edibles to start capturing more of the market share going forward.
Interesting. I just want to ask a quick question with respect to brands and the almost necessity to diversify in some respects based on the needs of various markets they're entering. So you made the comment, going to Oklahoma, childproof casing, this is forcing you to more or less adapt your business. I know your answer is going to be somewhat biased, but do you see this as ultimately the edge, maybe the competitive advantage that U.S. brands are gaining in the marketplace? Is they're forced to being adaptive, they're forced to being stronger in that respect, and and weathering some of these otherwise costly storms that for companies that aren't prepared for. Nate, do you share that sentiment, or do you think it's at the end of the day, it doesn't really matter, and it's what the consumer wants and its price and so forth?
Yeah, I think like Jamie said, I think there's going to be a massive shift in the next decade or so in how consumers use cannabis, and a lot of that will be driven by investment in technology. I think a lot of the current market makeup is due to supply, not due to demand, in the sense that, manufacturing is still improving, and it's still such an early industry. But to your point, I'm sure Jamie, with, a lot of experience in some of these newer emerging markets, to an extent you want product consistency, but in many other consumer categories, you have to adapt to the local needs and the local requirements. So, you look at Nevada, where we just launched about a month ago. Our core product is, call it a full 20 count of our typical gummies. But we look at that, it's, there's 40 million tourists every year, and most of the consumers are not repeat purchasers, and they're only using it for a weekend. So we look to, smaller pack sizes and having a smarter sort of a price pack architecture that makes sense for the market. So having local strategies is absolutely something that, brands and CPG companies will have to keep an eye on.
Jamie, just question for you. And just to kind of follow Nate's point about, that the comment about product consistency. You buy a Coca-Cola, whether you buy it in Thailand or you buy it in the US, it's going to kind of taste the same. Is that possible for brands right now in the US to have product consistency in various markets?
Absolutely. We've been doing that for 10 years and in multiple states. It requires having your manufacturing partners in those different states following the same SOPs, using the same ingredients. And the one thing that changes, and the only thing that changes, is the cannabis. And in our particular case, if you're using, you have the same specs for your cannabis oil that goes into your product, there's no reason why you can't have consistency. So, I would tell you we're absolutely an example that it can be done, because whether you buy one of our Bang bars in Illinois or New Mexico or California or, anywhere where Bang is available in the United States, they're exactly the same.
Interesting. And then, so Nate, if you can have product consistency, it's been done, great companies are doing it. Can you have brand consistency? So to your point, Nevada, you're trying to hit a target group of customers that you'll never get repeat business for. You might not, it's hard to say. But then, you go to another market where maybe the brand and advertising regulations are very restricting. So you can't, do what you could do, for example, in California. How do you get brand consistency out of your consumer group?
Yeah, absolutely. And I think Jamie will echo this one clearly. It's hard enough to keep a consistent brand, even in one state. In a place like California, where you have such a fragmented retail marketplace and a number of immature sort of retail operators. So investing in the channel and in store and on education is really, really key. And really making sure that you have, obviously it starts with your brand strategy and, what you're messaging and what you're trying to, portray to the consumer, and then making sure that it's actually being dispelled in the channels. So I think the most important thing is actually investing in the channels, given that the restrictive level of advertising opportunities and the fact that most of the likely purchasers are going to be directly in store. I think a lot of the brands who are succeeding right now are the ones who are investing in partnering with their retailers.
Interesting.
I think Nate's 100% right about that.
Yeah, sorry, Jamie, did you have anything to add to that?
I think Nate's 100% right about that. That's right now, I keep saying when I'm out in the world that the cannabis consumer, the majority of them don't exist yet. I think we've grossly underestimated how big our market's going to be. As an industry, I just think the explosion that's coming, I don't think we understand how big this is going to be. And part of that is, we look at what happened with CBD after the Farm Bill passed, and that's just one cannabidiol is one of 113, known cannabinoids. We're still discovering things. We don't have access to research. And I think what's going to happen is 10 years from now, we're going to look back and think, oh, wasn't that cute? It was a big CBD explosion. And we're going to know that THCV is an appetite suppressant, and THCA has, we call it CBD on steroids. Like, when we start really having access to research, the industry is going to change. And those consumers that we're talking about are for THC, I think, for the most part. And when we isolate all of the different cannabinoids and all of the different things that the plant has to offer that we don't even know about yet, I think we, as a rule, have grossly underestimated how big this industry is going to be. And so, going back to what Nate was saying, right now, in this very moment in time, the people that control those purchasing decisions are the bud tenders, because most new users walk in and say, what's good? And if you've won the hearts and minds of the bud tender, and if they understand why your product is good, superior, consistent, all of the things that you need to let them know, you're going to win. And so I think Nate's 100% right. The people that educate the bud tender and the trade channel are the ones that are doing well.
It's very interesting. I love that concept, is as research develops, products develop, and suddenly the one part THC, one part CBD kind of sounds ridiculous because it's a lot more sophisticated than that. What role, on that note, and maybe Jamie, just to get your thoughts on this, what role will brands play in advancing, maybe whether it's the research around, discovering new aspects of the cannabinoid system or the plants and so forth? Is that up to the brands, or is that the brands to leave it to academia to search, and then the brands are just the consumer facing end and just,
Well, I personally know of several brands that are partnering with research institutions, Bang being one of them. We've got an exciting partnership, and we're doing a rheumatoid arthritis study with CBD, because we don't have access to research, and the people out there that want to do it don't have access to funds. So there's creative and robust research going on that's being self-funded by brands. We can't make medical claims, but if we can have the research done, and researchers can prove with publishable studies that the things that we know anecdotally, people are getting relief and real results from CBD, for example. We're watching people with Parkinson's put 1 drop of oil under their tongue and watching their tremor stop. We know that these products, this is not just another oat brand craze. These products are helping people. And yeah, I think it is up to brands right now, the brands that are successful, that are out in the world, making money. I think it is incumbent upon us to move the industry forward where the government's not doing it. And I think that's been the name of the game all along. The reason we're sitting here right now in this webinar is because people have taken risks and risked their life and their liberty to make this plant accessible to people. And, here we are, within my lifetime, going from people sitting in prison, and we have really so many people still sitting in prison. And that's, another one of Bang's, causes and missions that we really feel strongly is doing something about that as well. I digress, but yeah, I do think it's up to the brands that are making money to go make a difference, for sure.
Thoughts, Nate?
Yeah, I mean, I completely agree. And I think we're in a day and age where, I think the brands that are most likely to, sort of win in the long run are the ones who they're likely going to be 3 to 5 or even 10 years ahead of medical research. They're going to be testing and learning on a consistent basis. And innovation is the name of the game here. So I think brands have the responsibility to be working, like Jamie said, with institutions on starting to kick off a lot of this research. But also we're going to just learn a lot from consumer behavior and from products being out there and from testing and learning. So, I mean, I think brands will ultimately play a huge role in that. It's the fastest way to gather mass amounts of data points. And our data is a lot better than it was 10, 20, 30 years ago on consumer behavior. So it will be up to the brands to try to, decipher that and understand what it means for future product innovation.
That's so interesting. I mean, at the end of the day, you are the last leg until these products hit consumer, right? And so there's a lot of responsibility. That's what I'm trying to say on part of the brands to ensure that, not only the correct messaging is getting to the consumer, but as well as the right products. We have we're just running a bit out of time here. I think there's one question that I'm told we have. Here it is. Okay, so this one actually goes to Bang. what's the future of CBD in cosmetics? Will we see a significant uptake in cosmetics with CBD infused in them? Will Bang launch CBD cosmetics?
That's a great question. We, two things. One is I went to a conference in Palm Springs a couple months ago called Females to the Front, and there were 350 women founders and funders, and it was a Shark Tank style event. There were 21 presentations, and I, forgive me, give or take a few, about 18 of them were female cosmetic CBD infused products. So I think if that's any indication, the answer to that question is it's definitely coming, and we're already seeing, great brands out there. There's CBD for Life, Maria Valentino. I can think of some off the top of my head that are doing really well in the industry. And Bang has already developed a line of women's skincare infused with CBD and men's grooming products infused with CBD. So yes, you should look for those coming very soon.
Jamie, thank you. At that, I have to wrap it up. I want to thank Nate and Jamie for joining us and giving their perspective on the state of the brands in the nation, I guess. Thank you.
Thanks, Graham. Thanks for having me.
Bye now.
Yes, hello.
There it is.
Good, thank you very much. And this is quite an interesting event. This is great.
Yeah. Cool. Do you want to, just to kick things off, do you want to sort of introduce yourself and Cannamerx?
Sure. So Cannamerx is the Cannabis Mercantile Exchange. We are an international auction platform for cannabis and hemp at the commodity level. So this is where you would move product in the hundreds of kilos if you wanted to, between growers, between processors, manufacturers / brands. We do not move consumer products. We do not move basic. If it has an SKU on it, we don't move it. But if you can put it in a shipping container and it is used for further production, then we will move it.
Awesome. So I just want to, I guess we'll start off with a question just with respect to if you have any good perspective on the challenges of trading these products as commodities. So, what are some of the key issues that face cannabis companies as they look to create and innovate?
So I think one of the key challenges with cannabis and hemp as a commodity is that the process towards commodification hasn't yet fully taken place. And this simply has to do with the newness of the industry, with the lack of standards, with the simply also a lot of the companies are still vertically highly integrated, especially in Canada. So there is a lot of the internal supply chains exists there, but there is definitely a growing need for external supply chains with companies procuring raw materials, ingredients for their products. So right now you have what I see, especially in Canada, brands still grow cannabis. And I think for a full commodification of that to be successful and companies gaining more flexibility is for separation between producing the raw material and the brands. And I think that is beginning to happen, but since the industry is only very young and was forced into this highly vertically integrated structure, this transition is happening, and it will probably be happening quite rapidly over the next 2 years or so.
And how do you think that transition will affect Cannamerx?
Our company is based on the assumption that the highly vertical integration model, while necessary to start the industry, is not the end game of the industry. If vertical integration were the only game in town, there would be literally no need for us. But with the separation of growers from processors from brands, there will be an increasing need to procure standardized, reliable raw materials, both on an ad hoc as well as a sustained basis, through a centralized system that makes it very easy to find product and to find buyers.
Mm-hmm. And so, and just to reiterate in your introduction, so Cannamerx is an auction engine.
Correct.
And I believe that was very deliberately and very important for you, rather than just doing a listing platform. And so what was the strategy there? Why do an auction engine versus a listing platform?
Auctions are fundamentally the most efficient and effective and fairest way to set prices, especially in industry where there are no benchmarks, very few reliable benchmarks. And auction is the best way to determine what is actually the price for a product. And it's also very fast and it's very fair. They are basically not manipulatable, and they simply allow buyers to look for product, see what it's worth to them, and simply submit a bid based on what the product is worth to them. Whereas the seller decides what is their minimum price, but they're not really sure how much they can charge for something. Sometimes the minimum price is too high. So if you're simply at the listing platform, people would look at prices and decide, well, that's too high for me, I can't buy this, and then move on to somewhere else. Whereas in reality, it might actually be possible to buy it if only you made a serious offer. It also makes it easier for smaller and larger, for small and large companies and new companies, as well as established companies, to work on an even playing field, because you're competing for the same product regardless of who you are. And you submit bids and you're simply evaluated on what you have to offer in terms of value. And the same goes for companies that want to sell. Rather than having to call hundreds of companies at the same time, which is impractical, they can simply put it onto the platform. It is seen by now over 180 companies, majority still in Canada, where we have almost the entire market on the system. And it becomes very fast and efficient to sell through the system, while also making sure you get a fair price.
Interesting.
And at very low cost. I mean, that is the other thing. Auctions are it's fully automated, so it's possible to run this at a very low cost.
Is that, though, does that disfavor the cultivators or those that are posting the product?
No, not at all. Quite the opposite. I think it gives serious advantage to cultivators, because what you do if you're a cultivator right now, you go and find a buyer. You call maybe 5, 6 companies that you know of, where you know somebody, and you make your offer. And that offer may be just the best offer you can come up with right now. You say, okay, how much do I think can I get for this product? You go in there, you make the negotiation, go for the price, and you may not actually get the best price, because if you get a good enough price for your product from the second or third company that you talk to, you will take that offer because you cannot come back and expect the same offer. With an online auction system, you put the product on and everybody can bid on it. And if 2 or 3 companies are interested in this product, they will bid it up to the fair price. And at the same time, if you're asking for too much, the market can simply tell you, not just from one source, but from multiple sources, that your price is simply too high. And then you can adjust, or you can accept a lower price. So it even makes price discovery a lot more simple and efficient and fair. So we think this is actually very beneficial for growers, because they have a much vaster pool from potential buyers to choose from directly without any intermediary except the algorithm.
So it sounds like you're in a very unique position, because you get quite a unique perspective on, the commodities. In this respect, I guess it's cannabis and hemp, what they're trading at, what market value is. I'm sure there's some sort of data collection engine, and I don't want to, maybe, there's a future business pitch here that you're already thinking about, but do you see that ultimately this data is going to be extremely valuable?
The data is very valuable, which is why, for example, participants on our platform have full access to the entire history of trades that happened on our platform, including trades that didn't go through, auctions that closed without sale, and auctions that closed with sale. So right now they can actually access this data directly, review it, including the COAs, including the chemical analysis, so not just average prices, but they can look at each individual deal. And the one thing we are seeing in Canada, for example, is a significant price decline, even from the beginning of this year, despite the fact that production capacity in our assessment is still not there where it needs to be to supply the entire potential legal market. But I think the price pressure is already beginning, even in the Canadian market, in anticipation of increased supply of raw material in the future.
Interesting. Would you almost say, and I wonder, is there a connection that could be made between what products are trading on your platform versus what's happening maybe in the, let's call it the default world, the real world? Would you say that, like, you can almost predict what's going to happen based on what you're seeing happening on your platform?
Predictions are very hard, except for the past. So predicting the future is difficult. So we anticipate certain things to happen. And that is what I mentioned earlier, the separation of brands from production, with increasingly companies sourcing their raw materials. And when I say raw materials, I mean particularly also extracts and the derivatives of the hemp and the cannabis plant, because they are much easier to use and much more predictable. And as was said earlier, consistent product and predictable product is very important for the consumer experience. And cannabis and hemp themselves, they are fundamentally agricultural products. They are not very, you can make them as precise as you can make a widget, but they have a content that when you extract it, you can make it into a reliable product. And it is very important for companies to have access to these reliable ingredients to put into their brands. And this is basically what we are seeing, that there will be an increasing divergence between the companies that grow product, the raw material, companies that process it into potential ingredients, and then the manufacturers and brands which purchase it. And as that increases, as there's a greater and greater demand for extracts, it will become easier and easier to actually benchmark product, because for the industrial level product, that means product that is grown for extraction, it will be priced based on the value of the extract. It is different, of course, for the product that is used for smoking. The individual bud, where the flavor and the coloring and the shape of the product is very important. That will be harder to commoditize, and that will continue to be a fairly complex market. But again, our platform allows trading of both. It's just in terms of coming to a predictable price assessment and a better understanding of where prices are going. We see it necessary for there to be a greater emphasis on the extracts from these plants.
Dewald, I believe you have to run. I was told this is your cutoff time. Is that correct?
I have a few more moments, so if there's one or two more questions, I can definitely deal with that.
So, I mean, that's, if it was, I'll say, sorry, if there's a question from the audience. Oh, we do have one. Yes. So this comes in, okay, does Cannamerx currently sell extracted raw materials, i.e. bulk full spectrum extract, or is it only cannabis flower and hemp flower?
We sell everything. So we sell the green material, and we sell the extracts, we sell the isolates. So anything that is, if illegal to trade in the market of the person that is putting it on, we allow it to be put on. So in Canada, we have the whole plethora of cannabis-derived materials. In the United States, for the time being, we're only dealing with hemp. But again, you can do the oils, you can do the extracts, you can do the distillates, including the biomass as well. So we have built this platform to be an easy way for companies to source product and to fully understand what the product is like, because you can see the COAs, you can see the photos of the product where it's necessary, but definitely the COAs, they're fully accessible, and therefore make it fairly easy to buy these products as well. So yes, we definitely have the entire range of raw materials as well as potential ingredients on the platform.
Dewald, I appreciate your time.
All right. You have a good day. Thank you. Bye-bye.
Sean?
Hey.
Long time no see. How are you?
Yes. Yeah, thanks. Everything is great. How about you?
I'm doing well. So to kick things off, if you wouldn't mind just giving kind of an overview on what the current status of the export regulations are across Latin America.
So I think besides just Latin America, we see this challenge around the world is, and I'll give you a perfect example, even though this isn't directly related to cannabis per se or CBD. when we were dealing with vaporizers immediately right away, where Brazil was becoming such a high demand market, and the volume really picked up. When our packages started being inspected by customs and immigration, et cetera, over into the country, they started getting categorized as e-cigarettes. And right away, it kind of put this whole cloud over the vaporizer space. And we're even seeing that in the US now with everything going on. So I think it's a really tricky question, obviously, because, it's so undefined. And we see this constantly around the globe, where the regulations one day could be one thing, something goes a little sideways in the industry, and then we see a new challenge. And again, wrapping back to what I said, we saw this struggle just with vaporizers. Even though it was meant for aromatherapy, day one they categorized them as e-cigarettes and made it virtually impossible to get vaporizers into the country.
Interesting. And so now, with respect, so that's, I guess, getting product into the country. What are you seeing from trying to get product out of the country?
So same challenges, to go through the process of exporting, and then is it a GMP certified facility, et cetera. There's so many different challenges out there in even the exportation of product. There's both sides to everything, obviously, on getting the product to leave the country. And we've even seen that challenge in Canada, where the products are being grown, and then, where do we go ahead and export it? And then is it stopped at the point of bringing it into the again? So we haven't really seen much movement on that side of things yet.
For you, is Latin America like an exciting market as far as like market size goes and opportunity goes?
100%, absolutely. The products, et cetera, the whole education process on CBD, the population you have over there, 100%, it's got to be on the top of your radar. But, even in Canada, where we're seeing this slow progress, and we were the first ones, we just celebrated the 1 year of legalization, as we all know. And here we were supposed to be getting edibles and everything else. And now, from what I'm told, we'll only see the first people getting accepted in a few months from now, which pushes into 2020. So even though everything's really exciting in the industry and everybody has high hopes, and we constantly see it, like even today, Hexo reported its numbers, and they're struggling in Canada, even though they were supposed to be one of these incredible companies that was going to blow through their targets. They missed targets completely. And we just see this constant struggle where, and it's only normal, right, in the industry that we're in, for these struggles to keep appearing. But I think from what we've even seen in Canada from companies like CanTrust and these others, it makes it even harder when we try to expand in these other countries with the difficulties, because Canada's being seen as the poster child. When things are being done really well in Canada, it reflects really well on the industry. When things are not done so well in Canada, it reflects on the industry, unfortunately. So I think that it maybe was underweighted at the beginning, when everybody was getting these permits to start growing and start this whole expansion and import and export, how much weight was really on everybody's shoulders to make sure that we were the best examples out there to be able to then go ahead and grow this industry the way it should be.
Well, that's interesting. So, that correlation between what's happening in Canada kind of ripples through the markets. And just to keep in topic with, specifically to South America, what are you seeing? What trends are we seeing in Canada? Maybe that's now currently rippling through Latin America in your perspective.
Yeah, so again, I could really speak on the vaporizer demand, because that was really my background in the industry, was vaporizers, and the acceleration over there was just tremendous, the demand for the products that we saw. So, I think even in, if we, again, I don't want to go back to markets like the US and Canada, because we're supposed to be focused on Latin America, but at the same time, we need to look at, when there's this vaporizer scare in America, it doesn't mean that these vaporizers or liquid cartridges, et cetera, aren't going to be used in the US. You know, does it start making people go back into the black market, where in Latin America, that's really the only way people are currently buying their products over there, you know? Very, very small the last time I heard, and I haven't really received an update, at least for some of the markets. Hey, if you got the product into the country, then it was legal. But, you know, if you tried importing it into the country, then you run into problems. So, you know, it's all over the map on the legalization presently. But as far as demand goes, and if investors are listening and somebody definitely has an edge to penetrate that market, I definitely think you got to listen and tune in, because that market's definitely going to be an extremely powerful one.
So, and now we're saying Latin America has this very broad, sweeping umbrella, but obviously, you know, Latin America's, you know, every country has its own sort of, you know, they're at their own stage of whether it's legalization or medical, or even just social stigma, and, you know, alleviating some of that. For you currently, maybe to talk more granular, what are some of the specific countries or markets that you're most excited about with your business in South America?
Yeah, that's again, very, very tricky question. Like, you know, Kieran, who Darren Collins was one of the original partners over there, CFO, you know, who was our CFO at Namaste at the start, you know, even speaking with him, he goes, it's unbelievable in Colombia, great market, et cetera, but they still haven't even really sold a gram yet in Colombia. And we were supposed to see these sales over there, you know, already. So we keep seeing these delays. We keep seeing these challenges. So it's a very tricky question when you ask, what region am I most excited about? I think cannabis as a whole is an incredible medicine that should be given to the population. It should be up to the population. You know, I think at this point, and I've been meeting with a few health professionals, et cetera, studying different types of products, not just cannabis. You know, psychedelics, as we know, is next on the agenda. And when we speak to them and give me a bit of a 101 on the different stages that drugs need to go through before it actually gets approved. And one of them is safety. That's the most important thing to everybody before we start going at phase 1, phase 2, phase 3 drugs. And at this point, we all know cannabis is safe. You know, there's no argument to that, whether people have different effects due to it, different strains. But at the end of the day, cannabis itself is safe. So why is there so much red tape around legalizing it, which is simply just continuously forcing people to go the black market? So I think in all of these countries, we know the demand is 100% there. It's all a matter of getting through this red tape and then working towards other things, because we even see in Canada where there has been a ton of red tape, we still run into problems, which then ends up collapsing the legal side of things, which then drive people to the illegal part or the black market. And then when they're finally ready again in the white, you know, in the legal market, now to get people to adapt once again, I think will be extremely hard. So I think in Canada, even though I was really proud of how it rolled out in illegal, I think that due to it not being rolled out properly and so much effort going into it has actually caused the reverse effect here in Canada. And I think that these international markets should really take a good look at the mistakes that have been made and try to do a better job in getting the product out there as quickly as possible into people's hands.
So you made a comment with respect to Chiron, the CFO, and just him being a bit taken back about, you know, some of these promises that were made as far as regulations in certain Latin American markets and how long it's actually taken. Is that a trend that we can expect throughout South America, that, you know, there's all these grand promises made, you know, even politicians winning elections on with, you know, these grandiose ideas, but in reality, it's just that the market is still a long ways away until we'll see anything like regulation around cannabis?
I personally think so. You know, again, this is just me speaking on my opinion, but the product that we're dealing in, used to be a big no-no, and there's this really bad stigma around it around the globe. So, even though half the population might be open arms to receive it, on the other side, and if you brought one of them on your show, they would say that, cannabis should never be legalized. So you have those people yelling and screaming. So what happens from that side of things? So, I guess in each country, it depends how many more people you have screaming on each side of the tape.
John, I know you're no stranger to IP plays. I mean, it's been a big part of your background. Do you think Latin America is an attractive opportunity from an IP standpoint? Yeah, like, are you looking at Latin America more strictly for commodity trading, or is IP in the future?
So are you speaking in regards to like IP on strains, or in which regard?
I mean, I know for you, a lot of your background's technology.
Right.
And I mean, I don't know, maybe I'll just let you answer that wherever you want to take that.
All right, yeah. So if we're talking about like a platform-based technology, as far as intellectual property goes, our IP is only as strong as the brand recognition and the following that we create around the platform. So I've always been based, even when I was CEO at Namaste, my main focus was always building out a platform that allowed individuals to share. Because at the end of the day, if we're waiting on doctors and medical professionals to give us what the benefits are to cannabis, we'll be waiting a very long time. And my idea was, if CBD cream works for arthritis, why can't our consumers go ahead and share that information? I would all be about building out a platform in Latin America. I think the demand is there. I think people want to share. So as far as building out and efforts go, it definitely would be in my top 3 globally as countries that I really would want to focus on building my platform towards.
Interesting. And so now we've been talking strictly about cannabis. I mean, do you see when you think of Latin America and where opportunity lies, whether it's the IP, cannabis commodities, is hemp, CBD, or infused edibles, is that part of your equation? Is there merit there, weight to be given, or are we still thinking in terms of, commodities and
I think we just need to get going. You know what I mean? In some of these countries, like we even look in Canada, right? And if you look at it, from my understanding, there's still problems even with hemp CBD being digested, right? Like, how's that even possible? Why is that illegal when cannabis is even legal? Like it just, there's so many things that still don't even make sense in Canada, which is more mature as far as the legalization process goes. So when we speak about Latin America, I think we're so far out from even deciding, hey, edibles and all these other things. I think that's to get going. We need to start on some form of legalization to begin with. Like I said, even a vaporizer and e-cigarette are being categorized under the same umbrella in all of these countries. And, I always question, to be completely honest, are e-liquids even safe? What's going in? I remember always asking Corey this, when I'd see these liquids being put through the lungs, and now here we fast forward 2 years later, and it's actually turned out to be a massive problem. Now, it's out there in the open that it's a massive problem. And we all know cigarettes are bad for you, but we still walk around and see plenty of people smoking cigarettes. So at the end of the day, even if there's this warning sign that e-liquids or edibles, etc., could potentially be dangerous, why not still legalize it? Cigarettes are legal, and we know for sure people are going to die from them. Like, that's not like, oh, maybe you have a 50-50 shot in being okay. It's guaranteed you're dying, from some type of result from smoking, unless, God forbid, something happens to you earlier. So same thing with cannabis. Get it out there, put your warning signs on there, because people are still going to do it. If I enjoy vaporizing oils and now they're made illegal in any of these countries, guess what? I'm still going to be able to find that oil. I'm still going to buy it illegally, and it's my own body that I'm doing it to. it's my problem, you know. And again, I think when we go back to the question that you asked, we just got to get these products into the markets somehow, whether it's edibles, consumables, or anything else of that nature.
I could see politicians now running on that. I have to get this out of you just because this is a South American conversation. What country specifically are you most excited about as far as, you know, regulation or opportunity?
Yeah, so I still have strong relationships in Brazil, and I really, really strongly believe in their population. They adapt really to global movements and so much more. So my main focus would still be focused in Brazil.
Do you think Brazil, though, will activate or bring at least medical online anytime soon?
I believe so, but again, it all takes a few people connected the right way to make these things happen. And, Brazil, they've started the introduction of allowing cannabis into the country. But like I said, that's where the framework is a little iffy on how you bring the product in. Then it's okay for medical use, but bringing is the problem. So all these things are a little funny.
And just out of curiosity, because I'm unaware, what is the distribution, like what does that supply chain look like in Brazil?
From what I understand, doctors are able to go ahead and prescribe it. But again, the problem lies on not being able to go ahead and distribute the cannabis in the market. Now, I've been out of the market for a few months, so I can answer that, with 100% certainty. But when I was involved, that was the law and framework around it.
And just out of curiosity, I don't know if you would know this, but is it something where the doctors would be prescribing brand specific, or would that be up to the pharmacies to determine what products ultimately?
From my understanding, they go ahead, they give you the license, and then it's up to you wherever you go ahead and get the products.
Okay, so similar as in Canada.
Yeah.
Versus like Germany.
Except in Canada, you actually have an infrastructure to be able to go get the cannabis legally. In Brazil, that's not there as of yet.
Very interesting. And so when you were, for example, shipping pens to Brazil, I imagine it was, there was quite a substantial market size. Was there any, this was even before recreation was live in Canada, like, in your viewpoint, when you were building a business around that, was there ever the foresight that, hey, like this potentially could be legal and we're going to be ahead of the game as a result because our brand's in market, even though it's technically not legal?
Well, all our products never had any type of oil or grass or cannabis or whatever you want to relate to the product inside, because it could have been hay, it could have been tree, it could have been anything that people used our products for, people genuinely could use it for aromatherapy. I just went ahead and ordered off a site called Aroma, one of these aromatherapy machines that, let off the aroma. Why should that be legal? It doesn't matter. So our whole idea, or my whole strategy originally, was to lead with a product that has no boundaries, collect a whole database full of B2C consumers. And then when cannabis or any other product was introduced into the market, we would then be able to take the names that we have a relationship with, a connection with, and then introduce them to these new products.
Very interesting. Okay, I'm getting word. We need to wrap up. Sean, as always, it's a pleasure. Thank you for joining us.
And I think it's wonderful what you guys are doing. This is a great idea to be able to log in and say hey to Bill for me, and keep up the great work over there. And hopefully I'll see you by the end of 2019.
Yeah, hopefully. Thanks, Sean.
Cheers.
Gustavo, Mauricio, good afternoon. How are you guys doing?
Hey, what's up, Andrew?
Hello, Andrew. How are you? Why don't you guys take a few minutes just to introduce yourselves and your companies, and then we'll get right started.
Yeah, please go ahead, Mauricio. Okay. Hello, everybody. My name is Mauricio Kraus. I'm one of the founders of Cannabis, which was subsequently purchased by Plana Global Holdings in 2018. We are a B2B company. We have operations currently in Colombia, in Nemocon, an hour and 20 minutes north of Bogota. And we're expanding footprint across different South American markets for cultivation.
Yeah, great. Hello, I'm Gustavo Escobar. I'm one of the co-founders of Clever Lips, one of the first licensed producers in Colombia at the very beginning of regulations. Actually, almost at the same time with Mauricio, in the very, very beginning, building the industry from Colombia and South America to the world. Right now in Clever Lips, I'm working more on the innovation department, leading the whole efforts for product development, for genetics development, technologies, bringing better technologies for cultivation extraction, and different approaches that we have for customer experience projects and medical research, like medical trials in Colombia and other regions. Clever Lips mainly already have a considerable size of production, almost 1.5 million square feet of cultivation and operation, already up and running at local GMP in Colombia certified lab for extractions and medical formulations. Already export product raw material mainly to Europe. Raw materials more on the CBD side, and also have already final products in the European markets. Local presence also with some teams locally in Germany and in the United Kingdom, basically.
Thank you, gentlemen. So as we've heard them come before, and even sort of touch points during the European panel as well as the both North American panels, you know, Colombia is already famous for cannabis extracts, but I'm actually, before we start to dive into sort of extracts there, I'm actually curious to hear y'all's perspective on the current domestic demand for flower in the Colombian market, and sort of supply chain in terms of flower to the processors in the Colombian market in terms of current availability.
Sure, I'll start with that one. Well, as you all know, the Colombian regulation is basically, the flower market is based on B2B sale. Flower cannot be sold to the general public. So the demand is being created only right now, currently through the companies that are currently licensed, the LPs. In addition to this, as the time progresses, as second level license holders come online, we believe that new license holders that will only dedicate to some part of the market, meaning either final products. So they'll need a supply of flower from flower producers. So the demand is growing, but right now it's extremely limited. There's only a few companies, as you've heard in the last chat, and nobody has really massively produced anything for sale. Colombian regulation is full of red tapes and hurdles in terms of registration products. So currently most of, or if not all of the companies in terms of massive distribution are currently struggling with the red tape when it comes to commercial distribution.
And
Yeah, right.
Sorry, Gustavo, yes.
No, I think just in addition to that, for sure what Mauricio says is correct. But currently, just to give you a sense, in Colombia, the production for some local studies of the production, more than from the offer perspective of the business, is already currently close to the 5 million square feet, 50 hectares on production, roughly. All the flower goes through more than a B2B model for looking for produce, majority of them raw materials for different countries for export. The local demand in Colombia is still something to prove. Not for flower for sure, as Mauricio was mentioned, for more from the transformation of products, because there's still some things to be allowed to do in terms of permits for local access products in the local market. But Colombia is hitting large volumes of production on the vertical integration model of different companies. But we truly believe, and we agree with Mauricio, that the industry will move for companies that want to focus on the add value of transformed products. And there will be opportunity for some other producers to start sourcing more like flower in the raw material mode to those large producers of end products. So that's something that is going to happen in the next years for sure.
And that's the sort of the B2B model. Can you talk sort of about the domestic consumer in Colombia, right? Very rarely does any sort of talk about the domestic potential with 40 million people there in terms of whether it's the CBD products and cosmetics and or cannabis flower, medical cannabis flower. Maybe you can talk a little bit about the consumer to that effect.
Well, again, to give a point, the flower cannot be sold to consumers directly. That's a big no-no. So it's an extract based industry. So consumers will, unless it's from auto cultivation, which is allowed in the country, flower cannot be sold currently with the current legal framework.
Yeah, Colombia has been done a truly a strong effort on developing a truly pharmaceutical grade approach of the industry, where everything has to be extract and producing final products, and the products has to be registered at the health local institutions and regulators. That give kind of calculation, maybe 15% of the population might have access for some specific pathologies, but there still is something to prove as soon as the companies have the whole clear path to get into the local market with those type of products, which are at the end pharmaceutical grade products.
Right, and so either at that point, it's not even about consume. You know, when I understand completely, the consumer model is based on extracts. But so at this point, if we're talking about formulated end products, how important right now are the companies devoting, and how much resources are companies devoting resources to consumer end products, to those be distributed both in the domestic market and perform true R&D to then obviously be exported as well, sort of consumer end products?
Well, as a matter of fact, in terms, as you very well know, Latam is one of the largest growing markets for cosmetics. One of the LPs has invested a lot in their final product for cosmetics, and right now it's the easiest way to market, not only in Colombia, but throughout the region. So in the terms of market size, cosmetics would definitely be the largest one, and where access is most permissible in terms of size.
Gustavo, anything to add there, or sort of that's?
No, that's correct. I think more from the medical side, there are here the companies are investing to source not just raw material, which is like the fast track or the easy path to start generating revenues for the company outside of Colombia. Colombia has also the availability to export raw materials and even end products to different geographies where cannabis is legal from the medical perspective. But also the companies are taking the time to move at the same speed that regulators let us move here locally in Colombia to do the proper developments and register the products. But that's something that, being a final product, pharmaceutical grade, some of them, and cosmetics more lighter in some way, take time. And it's taking time for the companies. It's taking maybe you are seeing at this point already many companies on the cosmetic side, on the topicals, with different offers already in the Colombian market and export to other markets. I think the next year will continue in the same line of the topicals and the CBD-based products. And maybe 1 year or maybe 2 years from now, at least, it will be the reality of the truly pharmaceutical grade products that it's going to take in longer to have those official registers at the health agencies here.
And in terms of the pharmaceutical end product, right? The conversation in Israel, as an example, in terms of genetic research, is starting at the genetics themselves, right? Being able to understand and sort of standardize genetic profiles to condition. Can you talk a little bit about sort of research and development on strain breeding and sort of genetic research that's happening currently in Colombia?
Yeah, I think it is important what's happening in Colombia related to that topic. Even we cannot, use flower as an end product. We can use generic actually as another source of revenue officially in Colombia. You can sell officially in Colombia like official genetics that has been registered in the agronomical agency of the country. This is by like one of the first, if not the first regulation in the world since the beginning of building the industry in Colombia, that every local producer for commercial proposal has to register the cultivars as an official list. And that gives us kind of an advantage to trade those genetics in Colombia and actually to export to other countries on the whole, like large development that's going to happen worldwide. So that's a good opportunity for Colombia for the commercial perspective from the genetics kind of conditions that we have. And based on that, there is companies like vertical integrated companies like us, but also I know from different conversations that traditional kind of seed banks coming from Europe and coming from other countries actually are coming to Colombia to allocate resources, to put R&D in here, to licensing this kind of seeds production that are able to genetics that you can trade, and also start adding more resources to R&D new genetics that have the possibility Colombia to do it actually in a low-cost model here in Colombia with high quality value. So that's happening. That's a reality in Colombia. Colombia actually has a good brand as a country, you know, for the industry. So if you combine the official registry that everybody is obligated to have, the companies that from R&D genetics perspective are looking to set up operations in Colombia, and the brand of, you know, being Colombia historically, you know, Colombia as a country in the drug side is, I think, is going to be a good trend of genetics producing down here from Colombia to the world, actually.
In addition to that, I would like to, well, kind of extend a bit on this seeds of origin, so to speak. As regulations have been opening up in different jurisdictions, one of the genius things that the Colombian government did explore, and that's why I think that definitely, as Gustavo says, seed genetics is going to be a big deal here in Colombia, is the fact that they understood and they're treating this as any other agricultural crop. For you to grow an agricultural crop, you have to have a registered variety, a registered seed that has full traceability, and you know how it behaves. Unfortunately, due to illegality of cannabis for so many years, this was not possible. So as Gustavo says, a lot of seed banks are getting into Colombia to have seeds of origin and have actual certifications for them to export.
Thank you. So it's very exciting. Then, you know, besides everyone's so focused, I think, in terms of the conversation, who haven't yet had the opportunity to make it down to the Colombian market and meet people, you know, face to face. And extracts has obviously become, you know, globally renowned from Colombia. But I think that it's important that people know, you know, the potential of genetic IP and that sort of that effect as a tradable asset from Colombia as well. I'm going to sort of pivot and transition and talk a little bit about, you know, the classic conversation in Colombia in terms of commodity trading, which we've heard, you know, from Cannabis as an actual platform and many of the other players who are buying bulk right from Colombia. Do you see any of the major commodities traders, the coffee conglomerates or the cocoa conglomerates starting to either invest and or partner, whether as a distribution or logistics partner or an actual investment institutional investor into this industry in the Colombian market, or is that yet to happen?
It's starting to happen as the industry is developing and more people are realizing what they're good at in the chain of the value chain. Then experts in their fields, so like for example, coffee growers or even extractors of oils that just want to get into the cannabis sector, they're now looking into or wanting to partner up. In the recent couple of months, there have been a few conferences, not only cannabis related, but agricultural related or even investment related. And there have been a lot of approaches coming on to us in terms of partnering up to explore diversifying their industries with our product.
I think, yeah, to fully agree with Mauricio. I think like happens maybe to every industry. We've been crossing the champs in some way of the startup companies, the cannabis startup companies at the beginning, when the regulations maybe 3 years ago were pretty much fairly early stage. A lot of uncertainty of the sustainability of the regulation and the real opportunity and capabilities that you can build from Colombia. That was being done by some small groups related to flowering industry and some other like independent startups as Mauricio and myself, we knew from the very beginning with Mauricio actually. And then I think now that the industry is a reality in the country, it promises a lot of good scale and potential to consolidate Colombia as one of the hubs to produce supply good raw material to the world. And then keeps the attention, is keeping right now the more attention from those traditional agricultural extensive crops that has been setting up in Colombia for other different industries, coffee, is plantain, banana, soil, corn. So those big groups are paying attention, are looking to have partnerships already with the cannabis companies that has been established in some way. Some others are trying to get into the space from scratch. And I think personally that is very interesting what's happening in Colombia, because if you see like the traditional global evolution of the industry in terms of cultivation, indoor has been like the way to cultivate and to be safe and develop the first steps of the industry in terms of products, genetics, and flower as a raw material. Then comes right now South America with a model which we transition to the greenhouses, open air greenhouses, but not taking the whole risk to the outdoors fields, which is more difficult to get a stable genetics and get a stable production because of the open conditions of the environment. And now the companies, not just in Colombia, actually with the CBD and with some specific strains that are, well suitable for external conditions, are transitioning very heavily for the outdoors operations in extensive and massive size crops. So as soon as the industry is basically evolving to the outdoor operation and getting stronger genetics, good condition of genetics, finding the proper technique to be pharmaceutical grade or consumer products certified for those type of products that at the end the brands are looking to have. The outdoor game is going to come very, very heavily in Colombia and in I would say like the agricultural countries. So as is happening right now in the hemp industry in the US. So this is happening now. This is the moment in the industry that we're transitioning for large extension of outdoor fields. And then is when the big players from Colombia, traditional players, are more interested to be part of the industry, I guess.
So you're saying potentially in 2020 and certainly by 2021, the same way we've seen, this past year, the very exciting investment from Constellation Brands and Canopy Growth, it's very possible that we'll see some of the cocoa and coffee conglomerates placing very serious investments into one of the Colombian operators.
Maybe.
That's it.
Maybe. I
Who
think
knows?
that might be an opportunity. And as Mauricio described, there will be some specific companies that are going to focus more on the transformation, brands, and distribution. And for sure, it's not a crazy idea that someone's like us that give us already that capacity is more logical transfer to have a larger scale on that to those type of partners. I think it's feasible to do that.
Okay, I have one more question before we end and move on to the Australians, and I'm actually going to pivot into the Australian conversation, sort of. Right now, the expected projections in terms of the largest consumer market, and there were some disagreements through these panels. California, Tom Zuber had the very insightful and sort of necessary approach to provide, information that as everyone's thinking globally, California is still one of the largest, is the largest consumer market, right? In terms of by dollar sales. And the Europeans who spoke before, there's certainly a significant opportunity, and obviously cleverly, Gustavo, you've had public relations reports that have gone about your exports into Europe. But there's an Australian play potential as well with the Colombian relationship, right? Until companies are EU GMP, is there that relationship with the extract export into Australia as a true pharmaceutical market? Is that something that Colombian companies are starting to consider now, as opening that form of trade?
Yes, definitely. Actually, Australia is one of our first target countries because of the regulation that we can transfer raw material, at least.
No, definitely.
That you did mention is that one of our biggest hurdles to export to any country here in Colombia is EU GMP. And as you know, to build out the EU GMP takes a bit of time, not only about the installations, but at the actual processes of the product. So the challenge is while we get to EU GMP, which I suppose most of the companies are looking into that, the challenging part is finding a way to export this narcotic raw material into Australia or into any other jurisdiction. And Australia is definitely one of the most, how do we call it? Llamativas. Yeah.
Interesting.
Interesting markets. Thank you, Gustavo. Most interesting markets.
Advantageous.
And attractive was the actual word that I was looking for. But yeah, so Australia is definitely a big player in this.
No, definitely it is. Actually, we already have supply agreements and almost ready to send some product to Australia. Many companies are looking to have that. Also, as Canadians and like kind of exporters already identify, Australia is going to be kind of a very interesting hub to move from that side of the globe to even to the Asian market in some way. So many companies as also are setting up operations in Australia because from Australia they can serve basically the other side of the world. So it is a good move. Colombian companies are connecting to Australia very well, in my opinion.
Gentlemen, thank you very much for your very insightful approaches. Both your companies have positioned themselves extremely well in that market, both on the pharmaceutical side and certainly on the B2B side with Plena and then Clever Leaves. Gentlemen, I'm going to move on to the Australian conversation, and we can talk sort of about that relationship more in depth there. Thank you very much.
Thank you. Thank you. See you next. Bye-bye.
Bye.
Hello, everyone. Thank you so much for joining me on this panel. I'm honestly very excited that we have such a variety of the leading experts from distribution and R&D all the way to the leading cultivators in Australia. I'm going to start our questions off our panel with points that I think that all of y'all touched on in terms of the serious increase in patient access in Australia. Let's just get a bit of a broad perspective on what does the 2020 trend of patient access look like? Whether it's going to be a heavily medical cannabis flower market, or are there going to be commercially available end products, formulated products? Are we talking true pharmaceuticals? Let's talk about the patients first in terms of Australia and the domestic potential there. Dr. Argawal, you want to open us up and start us off?
Thank you, Andrew, Thank you, Andrew, for the opportunity to speak. Look, it's something that I've been working very closely on since the start. Many have suggested that when patient access was a very significant political issue in early 2017 and even towards the end of 2017, that the company that I'm part of, Canvalate, was instrumental in making that change at a national level. And one thing we can say is we've probably reached the stage now where almost anybody who wants to get it and will meet the government mandated criteria to get it can get it. So there is now a plethora of medical clinics nationally. There's also a lot of very supportive doctors who will prescribe cannabis under very safe guidelines nationally. And there's also a lot of medical education being provided to doctors in general. So there's a significant change, if you asked me this question a year ago to now, very, very significant. We're at roughly 17,000 approvals Australia-wide. Now, when we say 17,000 approvals, there's usually about a 15 to 20% bill shock rate, meaning they get approved by the TGA, which is our government body similar to the FDA in the US. But when they reach the retail pharmacy to collect their product and they see the price of it, they still get a bill shock and they think, you know what, this is too expensive, and walk away without taking their product. So that's one issue at the moment. And number two really is the renewal rate isn't perhaps as high as it should be. And this is probably currently every patient must go through a process where they're getting authorized by an external body. So in most situations, probably in the vast majority, it's the TGA in Australia. At that point, the TGA specify what is the initial starting dose for the patient. And typically this is something that's subclinical. It's way too small to have any residual effect. But once the patient commences on that dose, it's the responsibility of their clinician or their managing person to then ramp up that dose to where it becomes therapeutic. And without that support network, many patients will find, you know what, this product doesn't actually work very well. So that's probably been the biggest change. We've now got doctors who understand how to ramp up the dose appropriately and reach therapeutic levels.
I'm going to move across the board. Elisabetta, can you sort of add any points there in terms of patient care access, what we see in terms of whether contract walls, in terms of pricing, what that may look like, or creating a model where there's a consistent consumer basis as well?
Yeah, look, certainly. So in talking to a number of the other companies, so I'm a director of the Medicinal Cannabis Industry Australia, which is the producers in Australia's industry body. So we get to hear from, on a regular basis, from the Office of Drug Control, from TGA, and obviously from a number of the leading companies. And so what we're seeing is that some of that sticker shock is occurring because the imported product is being warehoused And I've got to say, in the early days, a lot of those, what we call Schedule 8 warehouses, so people who could handle this schedule of product, were, I suppose, taking advantage of the situation when there was only a couple of them in Australia, and marking up the warehousing costs, and then also the distribution costs, because it was often very small quantities and the first time a distribution company might be doing it. Some of those distribution companies were really adding on to the price, and then pharmacies add extra just for actually processing the script, and then they add their margin. And so what's happened is the imported product is much more expensive in Australia than it would be in, you know, the country of origin. What we'll see as domestic product comes through is a downward shift in competition, as you would in any market. As more and more Australian producers come online, we should see that price go down, and we should see some relief in sticker shock. What we also want to do is really work with pharmacies to get them to understand this is a very big product line for what is generally declining markets in pharmacy, and an opportunity for them to actually develop a range of products that they would be able to provide to patients, and therefore reduce the price to those patients. So that's one area. The other part of your question was around what are the forms of products coming through, and in Australia it has predominantly been derivatives rather than bud. We are seeing more bud product coming through, especially as secondary scripts for people with either very severe, who are adult and very severe epilepsy, or who are experiencing pain, acute pain, so it's in a cancer setting, where they have a derivative, an oil tincture or a capsule product that's already being prescribed to manage their symptoms and chronic pain, but where now bud is being added into the mix to manage that acute pain. And that's new, and that's something that I think took the government a little bit to get their head around, because the biggest fear of the Australian government is diversion. And obviously, much harder to divert an oil into a recreational setting than it would be to divert bud. But that seems to now, after a few years of this program running, those problems seem to be alleviated. But we certainly think that with Australia's background and what the point of difference that Australia and New Zealand will have, I imagine New Zealand, so the New Zealand companies can correct me if I'm wrong, but I think one of the differences that Australia and New Zealand will have in the international market is a focus on GMP, because our regulatory authorities are pushing for these medicines to be GMP. We've also found in talking to governments overseas, whether it's the UK government, German government, Japanese government, that they want full GMP. So they don't just want GMP finishing or extraction, they actually want to know that the product has a GMP provenance. So from the very beginning of production all the way through. And that's something that the Australian regulation really does support. And while it hasn't specifically driven the cultivation to be GMP, we saw the writing on the wall by talking to pharmaceutical companies who would, we believe, be the end user of our wholesale product, and really have developed that GMP supply chain from beginning to end. And I think it won't just be the future in Australia. I think it'll probably be worldwide for medicinal.
Thank you very much. Tommy, do you have anything to add there in terms of the patient access, or would you like me to move on to sort of down to one of the cultivation style questions, just because Adam and Tommy, I know that's more of your sort of business model to answer that. What would you prefer? You have any questions to add there? Would you?
Oh, just a few comments. We've obviously noticed a vast increase in the patient access and the time taken. I remember last year it took about 3 months for us to process one application for a patient who had PTSD. Also, when we introduced herbal cannabis, we watched the cannabis product sit in the inventory for many months. Suddenly, we had a turn of, we noticed that the ODC was more acceptable to the processing of it, and only as this month it took 30 minutes for approval to go through. So I think that was a huge inflection for us. We were watching obviously the time, the processing, the way the TGA was processing our requests, and obviously the medical applications, patients waiting. So this year has certainly changed dramatically over the last 12 months. Thank you, Andrew.
Adam, do you have any other points to add there, or?
Look, I think it's been quite well covered off there,
Great.
Andrew. The only brief comment that I would make would be, I mean, very much alongside just that proliferation of acceptance within the medical community. I mean, we've seen in our discussions, and only as recently a few days ago, I was talking to a local practice that I've been involved with, who a year ago when I spoke to them was an absolute flat no, we're not involved in medical cannabis, and you'd need to speak to a specialist to, yes, we are prescribing, and, and we're finding that, across the board with many, what I would class as mainstream practitioners that, beyond, some integrated medical practitioners that were probably more open and responsive to prescribing in the early days. So we've seen that as probably leading into next year, into 2020, and as Dr. Sud said there, just in terms of the clinics, I think that's opening up just a whole host of education and access across the country. We're involved with a partnership with Compass Lifestyle Clinics up in Sydney, and I think some of those initiatives, and that's one of many, but some of those initiatives where there's education and doctor-led involvement certainly helps the overall access. So I think 2020 will continue to be a big year for opening up the access.
Okay, great. That covers the domestic marketing pretty well. All of y'all, thank you for providing such extensive answers in terms of the domestic potential. We're getting sort of short on time, so I'm actually going to sandwich two questions together to create what I think a pretty broad spectrum in terms of the opportunity in the export market. And so these two questions, bear with me, are going to be sort of sandwiched like this, which is one, we talked a little bit about intellectual property and on the Colombian call with regards to strains and genetics. So for the cultivators on this call, what's the Australian potential with regards to intellectual property as a tradable asset on that front, and to the medical professionals and formula to end product executives who are on this call, sort of the IP that's in relation to there. And then I'm going to broadly sort of tap into the trickle into the Asian market, and whether or not companies will take a position like Canadians and sort of go on the M&A aggressive to expand their operations outside of Australia, especially as we see more and more companies listing on the ASX. I know that's a long three-part question, but if you wouldn't mind sort of covering that to the best of your abilities and to your own individual, pick a point and sort of go from there before we have to transition to the New Zealand call, if that's okay. And we'll start with you, Adam, just because you spoke last.
Sure. Look, I guess just to head in a direction on some of that content there, I guess the ASX listed companies, I mean, we're seeing that already in terms of some M&A activity in overseas markets, and I think that will absolutely continue both domestically and globally, and I think those opportunities will continue. We're just seeing, as I'm sure everyone would agree who's been involved in the market here over the last couple of years, it's been very much a foundation period. The licensing has been certainly an onerous period in terms of time development to get to that stage. So I think we're now starting to see Australian companies that are ready to cultivate, that are ready to manufacture, and certainly with some ASX backing, I think, and we've seen it already with some international developments in processing facilities in Canada, for example. And I think the previous call on some of the Latin American opportunities, I think there's a whole host of opportunity out there for Australian companies that are looking to diversify their operations.
Tommy, do you have anything?
You've triple-barreled question, Andrew, so I'll try and answer them.
I apologize for the triple-barrel question. We're just trying to keep to time, but I think that's the best way. I'll let you guys pick what is the best sort of point you want to focus on, just because it really provides insight into the exportable assets that exist in Australia. I think it's very undervalued, and I'd like to know more about it.
Okay, so I'll try and answer it. Remember, it's 6:30 in the morning here, so a bit slow.
Right, again.
So you mentioned three areas. I think we have to look at market maturity. We're still very much walking and getting up on our feet very slowly. So I think we'll see a range of strains. I don't think it'll be quite developed, it might be half a dozen strains entering the market as companies, cultivators like ourselves, get up and get our genetics sorted in the initial breeding cycles. In terms of IP, obviously, genetics is critical, and Australia traditionally has as a cannabis culture, over many decades. So I believe there are well-grown genetics. Unfortunately, the legislation doesn't allow that into the market, so it's probably be a bit tricky, but I think there'll be a bit of creativity going forward over the next year or so, or two. In terms of the product diversity, we're looking, 3 types of strains where it's a 1-to-1 high CBD or a high THC, whether that's in a herbal cannabis or a extracted product, whether it's full spectrum or isolate, and very much you're seeing that all over the world. At the moment, we're selling literally 3 types of products. There's no maturity in what the customer or the patient, I should say, is looking for. So, it's stepping stones from that perspective. In terms of the Asian market, we're obviously at the door of the APEC region. Canatrek is looking very much to develop ties, literally from country to country, considering that we're looking to be a large-scale cultivator, and we have to look beyond our borders, although we do believe the Australian market is very lucrative and mature from I would say, illicit market. And you'll see, like in Canada, an illicit market versus a medical market kind of going head-to-head in terms of price, maturity of product. So small steps, but I do believe there's an opportunity for Australia to really be a mover in terms of entering the Asian Pacific market and providing these countries who may not even be cultivating or just looking at distribution in terms of accessing the medical community. Hope that helps.
Thank you very much, Tommy. And back to you, Elisabetta.
Yes, so I think what we're seeing right now is probably the early stages before major consolidation occurs in Australia. So we've seen a number of Canadian companies reduce their exposure to Australian companies, and I think a lot of that is due to the downward pressure on valuations in Canada and the amount of cash at bank that some of those companies have. So what that's meant is that some of those have reduced their exposure in Australia, but have distribution agreements with the companies that they had invested in, which is an interesting position for those companies that were affected and were early movers in the market. What you'll see is if those companies have not created assets for themselves in the supply chain, I believe that they'll probably disappear. Those that have developed assets in the supply chain will most likely experience consolidation because they're quite vulnerable. M&A, obviously we have a background in M&A in our company. While we have our own assets for the full supply chain to wholesale production of both distillate and finished goods, we are always looking at what are the best assets to acquire that would assist us in our market penetration. What we've done is set up agreements with pharmaceutical and nutraceutical companies to supply them wholesale product, and some of those have major presence in Asia. So we would see that you will start to see in some of these very young Asian markets for illicit medicinal cannabis. You'll see governments looking, while they're developing their own domestic production assets, will be looking to do what Australia did and bring in already manufactured product to their marketplaces. So you'll see that, and we also see that the development of these supply chains in Australia means that we're thinking quite differently to Canada and the rest of North America, and taking that BMP mindset into Europe, where that is what the regulators want. So I think it's a really interesting time. I think we're on a cusp, and you'll see probably a lot of settling of the market in terms of producing and who exists in 12 months.
Thank you very much, Elisabetta. And to finish this off, Dr. Agarwal, please provide us your insights in terms of formulated end products and the Asian, the Asian market, the GMP, sort of, you get to choose.
I'm going to spin this on its head a little bit there, Andrew. My belief is that Australia really has a special place in the creation of pharmaceutical grade products. So where we've now derived it well beyond the raw flower, well beyond biological or botanical products, but even further into biosynthetic or synthetic products. So really the future, I know you guys talk about cannabis 2.0 a lot in Canada, being edibles and derivatives, but really cannabis 3.0 is when it's a proper, standardized, validated, scientifically proven medication, and it's listed on the FDA or the TGA or the EMA. I think that's where Australia is really going to shine. So there's already a number of novel cannabinoid products which are being tested at research facilities and universities in Australia. And because of the Australian research system, where we have co-located medical schools and universities, and we've got a big culture of medical research and a government that's very supportive of medical research, I think this is where we're going to win the race. I suspect there's probably more novel cannabinoid research happening in Australia today than the rest of the world combined. And probably with the exception of GW Pharma in the UK, maybe Zynerba and Cara Therapeutics from Canada, we're probably up there near the top. Israel's probably very close. They've got a lot of novel cannabinoid patents, a lot of novel strategy there. They just, through maybe a lack of government support, haven't been able to commercialize that and export that overseas. But I suspect if we had this conversation next year, we'd probably have a whole range. I'd probably have 12 to 15 products that are very advanced in the drug commercialization pipeline that would be able to describe to you in some detail.
Everyone, I thank you very much for providing serious insights. I know this was a big panel. It was a pleasure speaking with you all, and we will definitely take this conversation offline further. Thank you very much.
Thank you very much.
Brock, Courtney, how's it going? How are you
Good,
today?
how are you?
I know it's early. I know it's early in the morning there. Appreciate
It's
you
not
guys.
too bad actually. It's, what is it, 9 o'clock in the morning? Okay.
Okay, so I guess
Yeah,
Melbourne. I
I'm
guess I'm
glad
okay.
we weren't at the start. That would have been about 3:30.
Let's start off with just the basic questions. So can you guys jump into to provide insights to those who are listening on what the new regulation is and what it really means for the New Zealand market, both domestically and or what does the new regulations mean for the domestic potential, and what does it mean for exportable commercial opportunities?
So
Brock, we'll start with you, I guess.
Okay, go with Brock.
Sorry.
Yeah, sure.
one.
So Brock here, MedGreen Pharmaceutical. Thanks, Andrew, for having us. So the question about what does the new bill mean? There's a whole lot of layers to discuss there. I'll hit on a couple points and then pass it to Courtney. But generally, the objective of the bill here in New Zealand, and New Zealand's done an incredible job of surveying and observing the global market to inform the development of its medical cannabis regulations. So they've done looking at Canada, looking at the EU, Germany, Italy, Australia, and taking pieces of that to really the ultimate objective being providing better access and affordable access to high quality cannabis medicine in New Zealand. As we're all probably aware, we're not a massive country down here in New Zealand. I think we're around 4.5 or 5 million people. So the domestic opportunity will be somewhat capped by that. But as we're also all probably aware, New Zealand is a major export economy. I think it's around 35% of total GDP. And so we do it well. And the law or the regulations aren't really holding anyone back from that. So it's being set up both for high quality prescription based cannabis medicine domestically and opening the doors for us to be a player in the international markets. I'll start with that.
Yeah, following on from Rocky's dead right. I mean, the design and implementation of the scheme is to enable equity and access to the economic benefits of medical cannabis and the industry as a whole, while supporting New Zealand in its trade and economic objectives. In saying that, we're a bit the opposite, in which we're not looking to grow, we're not looking to produce here in New Zealand. there's enough people, as far as I'm aware, in terms of what Brock said, because of our relatively small scale of economy. We believe there's enough people trying to do that already. Having also spoken about Colombia and its abilities, especially its ability to grow 365 days a year, we ourselves are more focused on importation of product and having product available now at this moment. So it's a different approach. It's an approach that's not the same as probably I'd say 95% of the companies in New Zealand are trying to achieve, but it's one that we're taking. We like to consider it a lot more risk-free, but it also opens us up to a lot of different products and opportunities globally in terms of expanding the New Zealand market.
Okay, I mean, no, that really provides the insight is that New Zealand in many ways could be a bigger importer than in some ways for the domestic market, obviously for importation, and then the exportation potential, I guess, let's touch back on what Elizabeth was talking about in terms of Australian GMP versus New Zealand GMP in terms of those regulations, and the effect to be able to export product effectively, EU GMP and sort of, what's going on there. How about you guys sort of provide insight into the whole GMP and pharmaceutical question where New Zealand is forced to position itself on that front?
From my understanding, I believe that New Zealand is going to be severely similar to EU GMP. The obvious reasons are, as I obviously see the fact that our domestic market is limited by our size, given the fact that we obviously are an export nation as well. We need to be able to export product to the world, and being EU GMP will allow us to do that. But that's probably something that Brock could probably expand on further myself, given that we're not totally focused on that at this point.
Yeah, happy to jump in. Courtney covered it in a nutshell pretty well, that in the proposed regulations, they didn't necessarily land on GMP 100%. They put in language about asking. There was a proposed consultation document that came out in July in advance of the December 18th finalized regulations, and they basically asked for public and industry feedback regarding GPP, GMP. However, the way Courtney said it is what I'm hearing since that public consultation document is that generally everybody was in line and in agreement with we're producing a medicine and therefore it should be under GMP to participate globally. We do need to follow EU GMP. There is for example, and I think Australia has the same. I think there are a couple of hiccups in finalizing it, but there is a mutual recognition agreement between New Zealand and the EU. There's obviously some complexities in the cannabis industry all the time. So that's something that sort of needs to be figured out with each attempt to export or import. But generally, it appears that things are being set up very well for both the GMP side and the export side as it relates to respective countries doing business together.
And I guess
and I actually
sort of cover
back from the EU Monday. Sorry, a little delay.
No worries. Yeah, I guess in terms of covering, I guess from the pharmaceutical perspective and IP, right? New Zealand, like Australia, has sort of a reputation when it comes to agricultural technologies, even pharmaceuticals in that sense. So, can you sort of provide insight in terms of strain genetic, genetic IP, pharmaceutical genetic IP, and or pharmaceutical IP as exportable assets from New Zealand, sort of the potential that exists there?
I know that New Zealand has or a proposed amnesty in terms of genetics, for example, where they're going to enable us to gather New Zealand strains or deemed New Zealand strains, enable people to come forward as growers that have existed in the black market and come and put those forward and potentially even patent those strains necessarily. In terms of importation and exportation of strains, I know that we have had people that have been licensed already to import high THC strains, and I don't believe there is going to be a restriction on THC, for example, being prescribed in New Zealand. Any further information in terms of IP or pharmaceutical IP in regards to strains, I'm not that upon.
Yeah, I can. Thanks, Courtney. I can jump in a little bit, and beyond the amnesty clause, which is an interesting thing because I've participated in some other global markets, or for example, I participated in the state of Florida, bringing on that state and a couple of their licensed operators. And when the question or the regulations were developed for Florida, they said when people started to ask the question about how you're going to get your genetics in, and the answer was basically, don't ask, don't tell. So New Zealand's putting in a program, as Courtney said, around amnesty. We are one of the, I think there's 6 or so 7 licensed companies right now under current legislation, which allows you to do cultivation and manufacturing for the purposes of clinical research and R&D. We have imported under that license. We have imported our cultivars from a licensed facility in Spain. So we are working with a number of different genetics right now under our breeding and R&D program. So some of that's being initiated. We will be going through the amnesty route as well to bring in as many genetics as possible and just sort of have a nice foundation. The one thing that Courtney said that I think is an important statement is the deemed New Zealand cultivars or New Zealand strains. It's just acknowledging that it's the black market. All we can do is start with the chemical profile that we get out of the first COA and determine how we move forward with it from there. But I think we'll have a fairly healthy genetic seed bank. I don't know if MedGreen Pharmaceutical yet at this point will move forward with any type of commercial seed production. It'll likely just be for our own internal use. But I have heard of other companies that are focusing solely on genetic development for both the domestic and export market.
Well, it sounds like New Zealand's truly an exciting emerging market, well positioned in the APAC region. Any other sort of points, Courtney, you want to finish off just for closing statements before we finish off here?
If I may add to that, and this is probably the exciting thing from more your previous guests or your previous talk, is that New Zealand is going to have, from what we understand, and we can only say what we understand at this point because we are getting indications from the Ministry of Health in terms of what they're citing for in terms of legislation. For example, their initial proposal was to have THC restricted to specialist only application. Now, the problem with that is that right now to get THC in New Zealand, it is through a specialist only, not a general practitioner. However, what the specialist has to then do is approve your medicine and go, okay, yes, we're okay with you having that. So let's take a rheumatologist, for example. It's hard to find one that's okay with THC, to give you an example, especially in New Zealand. But if they do, and they do put an application forward, as in my grandfather's case, it has to go forward to the ministry. Now, the Ministry of Health, believe it or not, approve about 98% of those applications. The problem is we don't have enough specialists applying for it. In fact, the specialists are more apprehensive to prescribing THC or CBD even for that matter than a GP. Now, GPs are hard enough as it is. So the good thing is that what we believe is going to actually happen in New Zealand is that GPs are going to be able to be prescribing THC and CBD products, of which we don't believe there is a limit on either of those. So in regard to a market, albeit us being only 5 million odd people, soon to be 5 million people, I believe next year, a quarter of the size of Australia, if not less, our medical cannabis market will be, dare I say, far more accessible and potentially larger in terms of patient demand than Australia currently under their current legislations with different states and laws and applications to the TGA, for example. We hopefully are going to dispel of that request.
Gentlemen, thank you very much. I'm excited to hear what's going to happen after these. The 2019 session comes to a close and 2020 opens up the new year. I'm going to now give over the microphone to my gracious host, Jessica, and my colleague, Graham, for the closing remarks. Thank you very much, Brock and Courtney, for your insights.
Thank you.
Yeah, so with that, I'd like to say a big thanks again to our partners, Grant Thornton, Miller Thompson, Zuber, and AC Lion. Again, without them, we wouldn't be able to bring together this global network of executives. So for our inaugural virtual conference, it didn't go so bad. We had great speakers today and great content. As we move forward with these virtual conferences, I just want to reiterate from my introduction, our focus is to increase the value and the ROI of your time spent here. So for example, as we move forward, you can expect us to integrate things like one-on-one virtual pre-scheduled meetings around the conference programming. This way, we can connect society members with other society members who can benefit from meeting one another with respect to very specific business development initiatives. For any viewers that were on the line today and who are not currently signed up as part of our Cannabis Society membership program, if you would like to play a more active role in these conferences, such as yourself connecting with the various parties that within our network, that some of them you would have heard from today, I encourage you to please reach out to us directly for more information. You can reach us at events@thecannabissociety.org, or myself directly. My email is Graham, Graeme, at thetechsociety.org. Easier to remember, events at cannabissociety.org, and we can help you with that. So thank you, everyone. Thank you, Jess, for making this all happen. And till next time, bye now.